and I won't go into great detail about my perspectives on this system, but suffice it to say, if we are overwhelmed with the complexity of this system, imagine what families experience. And I think you probably heard that from our two parents, but also from other panel members. What we want to do today is dig a little bit deeper into some of the things you heard about yesterday. And I think probably every one of our panelists addressed this issue, which is the differential experiences of children from minoritized backgrounds in this field, in this particular arena. And we know that those disparities exist across multiple systems. There's probably not one child serving system where we don't see these disparities, but it's particularly pernicious in child welfare, partly because, as I said yesterday, some people suggest that this system takes all the kids that every other system fails. So one could kind of think about a compounding of effects over time and over space and over systems. So by the time you hit child welfare, the disparities are so stark. I want us to really think about not just the disparities in outcomes, but the disparities in what children's experiences are, which is probably the thing that for us in HBCD is most important, because we need to be documenting this because it's definitely going to have an impact on kids' outcomes. So what I wanted this panel to do, and I'm so excited, and I'll introduce my colleagues in just one second to have them, I wanted us to really think about all the major groups. So we have folks who'll talk about the Native populations. We have folks who'll talk about African-American populations, Latino populations, because truthfully, as you saw in Brian's talk, although they all experience disparate treatment, it looks a little different. It really does look a little different. So I'm really thrilled to be able to introduce my colleagues who will talk about those. So I'm going to introduce all three of them now, and then I'll have them make their way up. First, I want to introduce Alan Dettlaff, who's a professor at University of Houston. And Alan not only hopefully will address Latino children, but really give us sort of a historical perspective. I heard him speak recently and said to him, Alan, that kind of history would be great to think about what the child welfare system looked like over the years. It's a really young system, but it's had some interesting peaks and valleys over the years. So I asked him to kind of address that. And then Darcy Merritt, who's from the University of Chicago, has a very interesting corpus of research where she looks at African-American children, but from the perspective of their parents and how they are impacted, to use Darcy's word, by the child welfare system. And then we'll have Carrie Wabanaskam. Carrie, did I do it right? Man, I am so focused on making sure I get people's names right. So I am so happy. I was listening to you yesterday. So, and Carrie's going to talk about a very interesting set of children, not only because we have not really done a good job of knowing the experience of Native children. I mean, our research is horrible. I just think it's horrible. We have not done a good job. Although I will say ACF is really trying to understand this group of children. But the other thing is they have a very interesting experience in child welfare because they are governed by a totally different set of policies and laws. So Carrie, fortunately, is going to talk about that, but also some of the colonial history that that sort of characterizes these children's experiences. And I didn't say, I was so excited about your name that I pronounced it correctly that I didn't say that Carrie's from the University of Wisconsin School of Social Work. Okay, so with that, I'll ask my colleagues to come forward, and each of them will do yeah, all three of you, just come on up. So each of them will do a 20-minute presentation, and I'm going to be like a mean old timekeeper. And then we'll have time for some discussion.
Good morning, everyone. So first, I want to just thank Brenda and everyone with this project for the invitation to be here this morning. As Brenda said, I'm going to talk a little bit about the history of the child welfare system and the racist history of the child welfare system, which is a deep topic to cover in 20 minutes, but I'll try to get through as much as I can. And then I'll just do a plug for myself. If you're interested in learning more, this presentation is part of a book I have coming out on September 1st called Confronting the Racist Legacy of the American Child Welfare System. And I wanted to start by giving just a little background on racial disproportionality and disparities, which was mentioned yesterday, but not discussed in depth. Simply, racial disproportionality or disproportionality means the state of being out of proportion. So disproportionality could mean that one group in the system is overrepresented. It could mean that one group is underrepresented. But typically in the child welfare system, we use the term racial disproportionality to refer to the overrepresentation of one group of children in the foster care population compared to that group's proportion in the general population. And since the beginnings of the child welfare system, racial disproportionality has most significantly affected Black children. If we look at this slide here, you'll see Black children are in the bottom green bar. They represent about 15% of the general population, although they represent 25% of children in care. The middle gray bar is white children, which you could see are slightly underrepresented in care. Above that is Latino children, which you could also see are slightly underrepresented in care. And then the top line is Native American or Indigenous children, which are very overrepresented in care. As Brenda mentioned, we know probably the least about Indigenous children's experiences in the child welfare system. And we know the most about Black children's experiences is because they're overrepresented not only at the national level, but at the state level in 46 out of 50 states. When we look at Latino children, we'll see that although they're underrepresented at the national level, they're overrepresented in about 20 states in 2020, and that's up from about 10 states in 2010. So the overrepresentation of Latino children has increased over the years. What I want to point out about racial disproportionality is that this is not a new phenomenon. This has been known to the child welfare system for 60 years. This is a book called Children of the Storm that was written in 1972 about the overrepresentation of Black children. This is a book written by Marion Harris in around 2011 about Black children's overrepresentation in the system. And then this is a book that I was editor of that covered racial disproportionality across groups of children in 2021. So we continue to write about this topic and have been writing about this, as I said, for 60 years, but the problem has remained unchanged, relatively unchanged in those 60 years. Racial disparities are slightly different in that rather than comparing, say, one group of children in foster care to that group in the population, we look at differences within the system between, say, Black children and white children. And what we know is that Black children are more likely than white children to be reported for maltreatment, substantiated for maltreatment, separated from their homes. Black children are also less likely than white children to exit foster care, stay in foster care for longer periods of time. So it's in each of these decision points. On the right here is a chart that's called a simplified flow of child welfare decisions. It looks somewhat complex to me, but every one of these diamonds is a decision-making point. And at every one of these diamonds, Black children are likely to experience the worst outcomes. Each of these differences in the entries and the exits to the system are what create the overrepresentation of children in care. These are also not debated figures. These are just raw numbers. The disproportionality and disparities of Black children is not a topic that's up for debate. What has been up for debate over some years has been why disproportionality and disparities exist. And you'll hear different conversations about that. People will talk about racism within, or structural racism within society. People will talk about biases within the system. I'm going to take a slightly different approach to talking about why racial disproportionality and disparities exist, to going back to the history of forcible separations in the United States. And we know that the forcible separation of Black children from their parents has been used by the state as a means of maintaining white supremacy for over 400 years in this country. Historical accounts of forcible family separations describe that between 1/3 and 2/3 of Black children experienced some form of family separation during the era of slavery. Accounts of these separations talk of infants being sold away from their mothers simply because their enslavers were annoyed by the babies crying. There are some accounts that talk of infants being beaten to death because their presence impeded the sale of their mother. And the intent of this practice during the time of slavery was clear. Separating children from their parents was the cruelest form of punishment that enslavers could enact upon their slaves. And they knew that the threat of family separation was even more severe than the threat of violence. And they used that to maintain both the subjugation of their enslaved people and to prevent any form of uprising. A unique characteristic of this time in history is that everyone knew how horrible family separations were, so much so that enslavers even denied that it was happening. But it was the trauma of family separation that was used as the seed that sparked the abolition movement, particularly among white people, white, rather apathetic people in the North who came around to understand the horrors of slavery because of the horrors of family separation. And what we would often see is images like this that were presented in anti-slavery newspapers that were disseminated throughout the North. And then while those accounts began to shift public perception, it was really this image and accounts of family separations that were documented in Harriet Beecher Stowe's Uncle Tom's Cabin that ultimately broke through what was largely public apathy. Uncle Tom's Cabin was the second most widely purchased book of the entire 19th century, surpassed only by the Bible. And the depictions of family separation moved people in the North so much to join the abolition movement that when Abraham Lincoln met Harriet Beecher Stowe, he said to her, "So you're the little woman who wrote the book that made this great war." That's how impactful the trauma of family separations were during that time. And it was ultimately these images of the horrors of family separation that brought about the war and brought about the end of slavery. For the country at that time, family separation and slavery were viewed as a moral and societal failure and could only be ended through abolition of the system that enabled family separations. What we see, though, is that after abolition of slavery and after passage of the 13th Amendment, Black codes were passed, policies were put into place to maintain the subjugation of Black people in the United States. So Black codes were passed immediately following abolition of slavery, denied voting rights to Black people, made it a crime for Black people to be unemployed, and essentially turned crimes that were formerly misdemeanors into felonies only if they were committed by Black people. And the purpose of that was to recreate a system of forced labor among Black people by imprisoning them and then leasing them out through convict leasing programs. The Supreme Court's Plessy versus Ferguson decision in 1896 affirmed the constitutionality of all of these laws. And today, then subsequently, Jim Crow laws were passed, and all of these discriminatory laws were constitutional until 1964. But we see that the intended outcomes of these laws persist through today. So we see gaps in poverty, the income gap, wealth gap that significantly impact Black and Brown Americans, health and stress, health disparities. Many people are familiar with disparities in mental health because of the daily experience of racism that people of color experience, but the experience of racism also takes a toll on people's physical health, a phenomenon called weathering, where the experience of racism actually breaks down the human body. So we know that health disparities result from racism, and then geographic context, things like racial residential segregation, discriminatory housing policies, implementation of the GI Bill, all of these things result in some of the conditions that make it more likely that Black children and families will come to the attention of the system. But we also know that the history of the child welfare system itself is responsible for the disparities and disproportionality that we see today. The history of the child welfare system started with what many people refer to as the orphan trains, which you see in this picture. The orphan trains began as a movement that resettled children from the Northeast into children who were mostly poor, many of whom were orphaned or their parents were disabled, and resettled those children to the American West in a system that mimics what we would call foster care now. That system only aided white children, though. So when you hear accounts that the orphan train movement relocated 200,000 children from the Northeast to the rural Midwest, it's actually the reality is that the orphan train movement resettled over 200,000 white children from New York to the rural Midwest. Black children were intentionally excluded from that system. And we see that same pattern after the orphan train movement ended. We see with the Social Security Act in 1935 and Aid for Dependent Children that was established solely for white widowed mothers who were given poverty relief programs so they wouldn't have to enter the workforce. As more and more Black people became eligible for those programs, states established eligibility clauses, things like man in the house rules, which limited Black parents' eligibility for those services. And in some southern states, tens of thousands of Black families were expelled from welfare rolls in the late 1950s, early 1960s because of those eligibility clauses. That led to passage of the Fleming Rule, which barred the use of those clauses, but also required that states investigate the families who were removed from the welfare rolls. So what you have is a white workforce that then went to investigate tens of thousands of Black families and ultimately led to those Black families coming into foster care, which is when disproportionality started. Public welfare amendments in 1962 further established foster care as a means of help for children who were living in poverty. And then we see in 1962, the Battered Child Syndrome, published by C. Henry Kemp, set off a child abuse scare in America that led to the establishment of state mandatory reporting laws. In 1962, there were about 500 reports of child abuse reported to the police. By 1968, when all 50 states had a mandatory reporting law, 11,000 reports were made. And immediately, the disproportionate outcomes to Black children and families were clear. In 1968, 45% of all hotline calls made to state mandatory reporting systems were on Black children and families, even though they represented only about 8% of children in the population at that time. CAPTA, the Child Abuse Prevention and Treatment Act, then solidified those disparities. The people who passed CAPTA had 10 years of research showing that mandatory reporting laws would disproportionately harm Black children and families. And they decided to pass CAPTA anyways. So people often talk about the unintended consequences of CAPTA, but think about what really happened during the era of CAPTA. The policymakers who passed CAPTA knew that it would significantly disproportionately harm Black children and families. They passed the law anyways, and then those disproportionate consequences became reality. That's not unintended when the outcomes are known. It's an intended consequence. The other thing that we also know about this time in our history is that it isn't a coincidence that all of the conversations about mandatory reporting laws were happening during the same time as the violence and racism that occurred during the American Civil Rights Movement. That time in history includes some of the most horrific acts of violence enacted against Black Americans. We also saw things like the Moynihan Report being published, which called Black families, particularly Black families that were led by Black mothers, entangled in a web of pathology. All of these things were influencing public sentiment at the time that state mandatory reporting laws were being passed and led to the outcomes that we see today. And these are the outcomes that we see today. Today, 53% of Black children will be subjected to a family policing investigation by the time they turn 18. Black children are twice as likely than white children to be forcibly separated from their parents. In some states, that's 3 times as likely. In total, 1 in 11 Black children will be forcibly separated from their parents by the time they turn 18. And in some states, that's 1 out of 8 children. What we see here through policy implementation over the years is that throughout our history, when white power is threatened, it's responded to with white rage. At some times during our history, that white rage is enacted through actual acts of violence, like as we saw during the era of slavery, as we saw during the civil rights era. But at other times in our history, when white rage when it's less popular to enact that rage through acts of overt physical violence, then that white rage is enacted through policy development. And that's what we've seen in the Black codes, that's what we've seen in Jim Crow laws, and that's what we've seen in the laws and policies that have established the child welfare system. I want to look at a couple quotes about family separation from some esteemed psychologists. This one says, the scientific evidence against separating children from families is crystal clear. No one in the scientific community would dispute it. It's not like other topics where there is more debate among scientists. We all know it's bad for children to be separated from caregivers. Given the scientific evidence, it is malicious and amounts to child abuse. To pretend that separated children do not grow up with the shrapnel of this traumatic experience embedded in their minds is to disregard everything we know about child development, the brain, and trauma. The effect is catastrophic. There's so much research on this that if people paid any attention at all to the science, they would never do this. When do you think these quotes were made? Any ideas? Right. All of these quotes were made in 2018 during the zero tolerance policy, in which we saw family separations happen. What's important to understand is that there is a disconnect in this country when we think about family separations. During the entire zero tolerance policy, the Donald Trump administration forcibly separated about 3,000 children from their parents and resulted in psychologists making statements like these, saying that family separation is tantamount to torture. The child welfare system in America forcibly separates over 3,000 children from their families weekly in the United States, to the extent that it's about 200,000 children every year. And those go largely unnoticed. We have nothing to say about them. So any study that's focusing on healthy brain development for children should be focusing on the consequences of family separation on brain development for those children. And then we also see here the intended outcomes of foster care. What we know about outcomes of foster care, and there's some debate about what we can understand about foster care because it's very difficult to come up with a comparison group. Most of the studies, or many of the studies that we know about outcomes from foster care, compare outcomes for children in foster care to outcomes of children in the general population, which then you could then say we can't account for any prior trauma that happened. The outcomes here that are shown on this slide come from a growing body of studies that do have a comparison group, whether that's children who've experienced similar forms of maltreatment but stayed in the home versus children who were removed. Some are from sibling studies where one child was removed, one child stayed in the home, and some use propensity score matching to establish a comparison group. And what we know is that children who experience foster care experience 2 to 3 times higher delinquency rates, higher teen birth rates, lower earnings as adults, more likely to have learning disabilities, behavioral problems, substance-related disorders, psychotic, bipolar disorders, and arrest rates 2 to 3 times higher and are more likely to have criminal convictions for violent offenses. Those are the outcomes of foster care. And it's important to note that these are the outcomes of foster care for all children. Foster care is bad for everybody. But the disproportionate involvement of Black children in the system results in disproportionate harm. And the reason for that is it's not that foster care in and of itself is uniquely worse for Black or brown children. The issue is that Black and brown children in America are already at risk of all of the outcomes that you see here. Black children in America are already at risk for higher delinquency rates, lower earnings, poverty, houselessness, substance abuse, incarceration. When you then add on top of that an intervention like family separation and foster care known to cause harm, it just increases the likelihood that all of these negative consequences are going to occur. And again, just a reminder, these are all of the issues in American society that maintain the oppression of Black and brown Americans. So the foster care system is creating and perpetuating the conditions in society that maintain the power of white people and maintain the subjugation of Black and brown people. So some questions to consider. Can a system that began with a racist intent evolve into a system that achieves racial equity? Can decades of racist policies be revised to no longer produce racist outcomes? But most importantly, is racial equity an appropriate goal for a system that produces harm? The answer to these questions, all of these questions, is no. But I want to focus on that last one because those of you who are familiar with the child welfare system know that the focus of the child welfare system right now is on achieving racial equity. They're very vocal about that. Asia Schomburg says that every time that I hear her speak, talks about the importance of achieving racial equity in the system. But think about racial equity and what that means. On one hand, it makes sense. If disproportionate involvement is the problem, then proportionate involvement is the solution. and that's racial equity. But what does proportionate involvement mean? That still means that hundreds of thousands of children are forcibly separated from their parents every year. They're just distributed equitably by race. But all of the harms of family separation in foster care still occur. So racial equity cannot be the goal in a system that fundamentally produces harm, because equitable harm is still harm. We have to start thinking beyond that and start thinking of solutions that really address the root cause of the harm that the system causes. And the root cause of the harm caused by the child welfare system is the forcible and involuntary separation of children from their families. Thank you all.
Thank you. Good morning, everybody. Good morning. I want to thank Dr. Jones-Harden for inviting me and the HEAL group. I'm very grateful, and I'm happy to be here with my esteemed colleagues and presenting in this particular section of presentations. So I'm going to talk a little bit about the lived experiences of Black moms that are interfacing with the child welfare system. That's primarily what my research focuses on right now. And you'll see my title here has the term catch ACS cases, which we can interchange CPS with ACS. And that's language that I learned, institutionalized carceral language that I learned from the moms that I've interviewed. So I'm going to go through some methods really fast because I only have 20 minutes and there's a lot that I wanted to share with you. So the slides are here and I'm happy to talk about them after, but I'm going to go through the methods of the study that guide the results that I'm going to present to you today. And then I'm going to talk about histories because histories matter, as Alan just highlighted. The history of slavery and the way in which families have been treated in this country is salient and cannot be ignored. We'll talk about systemic racism a little bit, and then I will go on and talk about what I've retermed CPS, child poverty surveillance. Other people call it the family policing system, family regulation. I think child poverty surveillance is what I'm going to call it from now on. And so I'm going to present sort of a case study of one of my participants who I've renamed Amy, and it's all about her experiences with CPS. And we'll talk about some issues that need to be addressed in the methodological world. And that's what we call left out variable error. Because increasingly we are with the quantitative data analysis, we tend to leave out a good measure of racism. And that's a problem. And I'm able to capture a good measure of racism with qualitative methods. And then I'll just leave you with an encouragement to follow a North Star. So this work is based on an R21 that is at the tail end with NICHD, and it's an elicitation analysis of parental perspectives. And it focuses on child neglect. We learned yesterday a number of times that on any given day, 76% of the children that are interfacing with the child welfare system, it's due to neglect, primarily poverty-related neglect and racialized poverty-related neglect. So I'm not talking about child abuse. I'm not talking about sexual abuse. I'm not talking about anything intentional. I'm talking about unintentional neglect. And so these are some articles that were generated from this work. So the two aims of this elicitation analysis were to just get mothers' perspectives on supervisory neglect and physical neglect and using qualitative methods. And then I wanted to identify any ways in which parents make decisions regarding neglect based on their working memory. So I employ a decision theoretic to understand how they make decisions based on their experiences and what pops up in their working memory. With regard to caseworkers coming to their home and people expecting them to behave a certain way or not. I'm going really fast, but this is the decision theoretic. This is what it looks like. I won't go into it. I can talk about it another time because I want to get to the actual quotes. So the qualitative part of this work is I employ a phenomenological approach so I can get at the crux and the meaning of these experiences. Phase one began with interviewing both clinicians and in-depth interviews, clinicians and parents, just to get some information that would help me move on to phase two, which was the survey. I was supposed to be doing this survey in person, and then the pandemic happened. And my goal was to get 150 parents. So I had to completely be nimble and reverse everything. And so I hired this wonderful company called Kertwang, and they developed an electronic survey. I'm in the tail end of that data collection. And as of right now, I have about 92 surveys that have been completed. I've over 400 attempted, but I had to surf through each one because bots are a real thing, and also scammers. So I had to like really vet the data pretty closely. And so this electronic survey was developed by Kertwang, and it's a qualitative survey. And they began with doing a focus group of Black moms to make sure that we had the language right for the survey that we were going to be include. And we also employed an actual mom who is impacted by the child welfare system. Her name is Cecilia, and she guides the parents through this electronic survey so that they feel safer when they're going through the process. It can be triggering. So that's what we're doing. And so they co-designed this. That's Cecilia. And this is just one, a document that Kertwang put together. So she basically says every question and guides the participant through the entire survey. She's lovely. I won't go into the demo, but I usually will click on a link just to show you what it looks like. But here's what happens. So moms, Cecilia asks a question, and then moms can record their answers. And then I can go back and listen to all of the answers, and then I transfer the data and the whole process begins, but it's very, very interactive. And after they finish the survey, then they get compensated $50. So this is a scenario that was born out of the focus groups and the in-depth interviews, because this was a common scenario. Moms were being admonished by CPS workers because they didn't have childcare. They had to make decisions. Do I leave my child at home with other children? Do I leave them with people that might be questionable because I have to go to work or I have to do this or that thing in order to survive? And so it's a scenario that we posed to moms, and we asked them whether or not they would take the extra shift or whether or not they would not take the extra shift, which could lead to consequences such as maybe we're ending up homeless if they can't pay their rent, or getting in trouble for some reason, for leaving the children home with an older sibling. So after this, we will then do, we're going to create a taxonomy and basically determine what comes up in terms of the decisions, why moms would make one choice over another choice. That's the quantitative part of it. So now I'm going to talk about throughout the rest of the presentation, the quotes that you see are from the moms that I've interviewed. And I wanted to make sure that we just sometimes we forget, like we all understand like racism is a thing. We understand it theoretically. We know the reading, we know it's a thing, but we forget if we don't think about what that looks like. So I wanted to include some pictures to just depict what that actually looks like. And where it came from. So here we have some pictures of back in the day, some moms that were slaves, and they're in the cotton field and they were working. And just look at the quote that the parent wrote. The mom actually said slavery. She actually was feeling like she was in those conditions. I thought when child welfare comes, you lose your kids. Once they get involved, I just gave up because you're going to lose your kids. Like the slave days, when they put us on a block and separated us and changed our name. Child welfare is the same thing, separating families. Now, I find it curious that here's Black moms, a depiction of Black mom parenting. I find it curious that even now, back in the day, Black moms raised white babies and children all the time. They still do today. They're called the help in some areas and communities. So if Black moms were okay to raise white kids, why are they not okay to raise their own kids now? I find that very curious. The second picture makes me think of the decision the scenario that I just presented with regard to moms making a choice whether to take their children to work or not to survive. So if you think about it, if there was CPS back then, this mom would have either gotten in trouble for putting her child in a dangerous situation in that cotton field, or she would have gotten in trouble for bringing him to work with her. So she would have gotten in trouble either way. either way. That would have been a choice that was made. And so moms are still making these decisions now. So I find that really difficult. And you can see here, this mom said, you can't even tell your kids why they can't go with you. So this is when she's talking about when caseworkers come to the house and she's like maybe going to visit, like a supervised visit, and the children can't go home with her and they're screaming for her to go home. They want to go home with their mom. So the issues here, systemic racism, obviously the issues. So my work is all underpinned by the conversation about the reality that racism does exist in our systems. And so we need to reimagine the child welfare system, in my opinion. We need to reimagine its purpose, its appropriateness to address the issues that the vast majority of these families are facing. And so the notions that racial disproportionality proliferates in these oppressive organizations, it cannot be disentangled with the lived experiences of racism and oppression. You just cannot disentangle them. I'm going to include in the presentation some more of these quotes, and we're going to talk about Amy's case. But these systems are racist. They are racist by design. It is how our country was founded. All right, so we have a storied history of discrimination, as we all know. It continues to manifest in all of these structurally oppressive systems in most of our social and human service organizations and agencies as well. We have a racist and oppressive environmental context that are the backdrop of all of the systems. And so for the most part, loosely heeded by child welfare scholars, particularly regarding Black families. And so I'm suggesting that the notion that the inherent race-based inequities are systemically supported and perpetuated in all of these processes. And as scholars, we need to be mindful of this. We need to be mindful and consider this in all of our work. The lived experiences of this racism amidst systems is directly related to being poor and the lower socioeconomic status. Thank you. And so there are the numbers. You heard about the numbers yesterday. 76% of the kids that are interfacing with the child welfare system, it's due to neglect. So those are the kids I focus on. I have to remind people often because people kind of forget that I'm not studying intentional physical or sexual abuse. I'm studying unintentional racialized poverty-related neglect. That's it. And that's really critical to remember. So I've put together this little flow chart here because I want to point out that racism is in fact the driver of concentrated racialized poverty, and which leads to racial disproportionality. I think it's the mechanism. So I'm not leaving this variable out in this flow chart. You'll see I've got racism, racial bias, poverty. I've added in neglect because I want people to remember that I'm talking about neglect. And then that leads to surveillance and reporting, but all things lead to reporting. Okay, now I'm going to play a little clip. I try not to talk so fast, but I'm talking fast on purpose. 30 seconds.
Man, is my mouth quivering for some of that fun ice cream. Please.
What you guys
26. Wait a
I'm not
minute.
going to play the whole thing. I'm going to get to where I want you to start.
6, 5.
Forms it here. Oh, shit. Honey, get rid of the TV and hide. Oh, it's Miss K back, the social worker. Well, don't just stand there, honey. Let her in. Miss K-Beck. Hi, kids. Hi, you, Miss K-Beck. Hi. How are you, Mrs. Price? Oh, just fine, fine. But, you know, they haven't sent me the authorization to buy the food stamps for the past 6 months. And then they cut me off for non-purchase. Now, Miss K-Back, why do they keep messing with me all the time? They call the system's one big screw up. Well, I'm glad to hear you say it because no one You're the gentleman that's been keeping company here.
I'm no man, I'm just a garbage man.
Well, may I have your name, please?
Simpson,
First name?
that's my first name.
Oh, your surname?
X,
Simpson X what?
Simpson X, that's it. You've heard of Malcolm X, I'm Simpson X. Hey, say, listen, I want to ask you something. You're supposed to give aid to dependent children, right? Well, why don't you just go ahead and give aid to the dependent children instead of worrying about who the mother is keeping company with?
Well, let me straighten you out on something, Mr. X. There was a time we'd ask to use a bathroom to see if there was a razor in the cabinet. We don't do that anymore, but we do have to know what's going on. But you live here or elsewhere. Is it a gift you're giving to the family to contribute to the support of this whole family?
Whoa, lady, you gonna tell us you can have this set? It didn't cost you in the city a damn dime, but you're gonna tell us you can have it, right?
Oh, I didn't make the rules, sir. I'm only doing my job.
The welfare ain't doing nothing for me, lady.
But the welfare is supporting Mrs. Price. Supporting? Supporting shit. Yeah, he gave me this. He gave me this. Yes, he gave it to me. And he gave me this. Now we have to hide this shit. You believe? Yes, he gave me this. We have to hide this.
He gave us this too, but it don't work.
That's right. Now I have to hide my man in the toilet. Miss Quebec, do you hide your man in the toilet? Mrs. Price, we want to help, believe me. We know that children need a man in the house, a woman needs a man in the house. We don't insist people be married.
Do you mean you'd help a man move in if he's not married to the mother?
That's right.
That's immoral.
Trying to deal with the realities.
What kind of example is that to set for the children?
Oh, what kind of example are you setting right now?
I ain't the government.
We'd love to see you get married.
Yeah, I'm hip you would. It would take the government off the hook and put me on. Ask me no more questions.
So do you remember when Dr. Detloff just said, he made reference that hiding, we had to hide the man? Because they're not allowed. Poor Black folks aren't allowed to have supportive men without the questioning. And this happens still today. This is an old movie, as you can see. Happens still today. This is the type of scrutiny that parents face when people show up at their house. And so, as I said earlier, there's this horribly disturbing language that's developed amongst folks that are impacted by the child welfare system. And people kept telling me they were catching a case. And I knew of that term from people involved in the carceral system. But now there's institutionalized language and vocabulary that's happening amongst CPS people that are involved. And so moms have to keep receipts. They have to navigate the world, show up in the world, keeping receipts, making sure they have documented that they took the child to the therapy session, that they took the child to the doctor, keeping grocery receipts so they can show people that they've bought some healthy food. So this is how these Black moms have to navigate the world, always being mindful of who's going to check them about how they're living their lives and taking care of their families. And it's disgusting and it's not fair. Having done all of these interviews myself, I sometimes have to check my own trauma because I have secondary trauma from having these interviews and as a Black mom myself. So these are some quotes that some of the moms had to say about surveillance, which is why I call CPS child poverty surveillance. This mom says she knows what it means to have caseworkers coming into your house and everybody's just looking over everything and under every microscope, just like we just saw in that clip. They use these terms, surveillance, we can't avoid it. And there's too many they're in the eyes of too many mandated reporters' eyes, right? What we need to do is change the way parents and families are responded to in crises. Change the response from punitive to responses that actually work towards healing and keeping families together and mitigating their crisis. And this mom points out that the response normally is about penalizing families for having crises. And here's another one. She says, it's just you're being watched. I mean, they hate to say it like that, but you have to move differently accordingly because there's always someone watching you. If you make one wrong move, that's it. You're stuck in this situation. And she thinks that money has a lot to do with it. And she remarks on one of the caseworkers, the first thing she said was that I see you're receiving food stamps. So she's being stigmatized based on the fact that she receives food stamps to begin with. So this mom again, catching cases, the language. She said, I didn't know people can get services without having a CPS case. Won't get services unless you catch a CPS case. And she says the kids in foster care, they get everything. She has to give up her rights, she's upset about, to get services and care. What about the struggling parents who have their children? So now I'm going to tell you about Amy. So this is just the background. Amy has had a 9-year-old boy, and he was consistently truant from school. And mom was having a hard time taking care of the household and providing for the children. What happened was mom was sexually assaulted and raped and was suffering from obvious emotional and physical trauma from that situation and struggling to take care of her kids. The rape occurred only 2 blocks away from her child's school. And so she had a hard time walking past that school to get him to school, obviously. The depression was actually debilitating for her, and she was paralyzed from caring for the family. So she confided with her doctor as she was getting treatment for both the physical and emotional injuries that were related to the rape. And she confided with the teacher that she was afraid and she was being triggered every time she tried to get that kid to school. What happened? They took her children. She confided for help, having been traumatized. She didn't get her kids back for 5 years. And so here she's saying, I'll point out the text that I have in bold. She feels like she put herself in a disadvantage when she was seeking help and doing the right thing and saying, hey, I've been harmed. This is what's happening to me. I'm having a hard time. And she knew that they were mandated reporters. So now she says she's opened up her whole world up for that, for the extra layer of surveillance while she was seeking help. So there's so much stigma around mental health in our community, in the Black community to begin with. So it was already a feat for her to confide in that way. And then the outcome and the consequence certainly wasn't going to make her feel encouraged to reach out for help in the future. And so one of the questions is, in order to do the particular analyses that I'm going to be doing, we ask the moms after they tell us what happened, we ask them who would have approved of this situation, who would have not have approved of your choices in this situation, why or why not? Okay. And so she says that the doctor comes to mind because she went to him for help and she was honest in her mental struggle. And she said, I was struggling. Instead of helping, she was punished because the doctor's a mandated reporter. And then she says, this is really sad. Every place that a person such as I can turn to in the city for help can also be the place that hurts her most. And she says, at any time, everybody is that nail to that hammer everywhere you go. So you struggle to ask for help because help is scary. And so another question is, what emotions or feelings did you have at the time that this was happening? And she said, fear of losing her children, pure terror. Pure terror. Now, I'm a parent. I can't imagine. Anybody who's a parent, you can think about that for yourselves. It's the biggest price to lose your children. And so again, I think it's really important. There's a debate, it's happening, it's interesting, it's happening. Evidence, what's the meaning of evidence? Who gets to value what evidence? Okay, we've got qualitative evidence and we have quantitative evidence. Both are great, so important. One should not trump the other. We can get at different interpretations of people's realities and experiences if we actually pay attention to the qualitative accounts. But we cannot be championing one over the other, because who gets to choose what evidence is more valued? Who makes that choice? So I really approached my work from an intentionally anti-racist, anti-oppressive approach, from question development throughout the entire process of my design. And I incorporate the insights of people with lived experiences, because I don't have the same lived experiences. I might be a Black mom, but I don't have the same lived experiences. So I need to reach out and make sure I'm doing it right and I'm not causing additional harm. We need to be intentional at this. And so we need to always think about who's valuing what evidence, for whom. So I encourage you to take an anti-racist science approach and then make sure to consider any variables that you're leaving out. And sometimes you can't get at measures of racism with certain types of methodologies and data sets. So this other mom said she thinks of racism. She said, these moms are calling it what it is. I'm not giving them this language. They're giving me this language. And so I want to end by calling everybody to a North Star, and I want people to try to just like pause and try to understand and support parental behaviors and consider unintentional neglect. And like, let's not be on our high horses and like swoop into people's lives and tell them what to do when they're like suffering from like decades and generations of being disenfranchised and marginalized in their efforts to raise their kids. Like, how rude, right? So we need to reflect, because CPS is traumatic. And these folks, people from my community and other communities that have experienced structural oppression and discrimination, they have to struggle with this every single day when they navigate walking about the world in the skin that they're in and with the dearth of financial resources that they have to live with. So we need to course correct. We need to be historically aware. We need to be sensitive. We need to think about advocacy action. And we need to assess every family with an anti-racist and social justice lens. Instead of saying, what did you do? Say, what happened to you? Because something outside of them happened to them. And I think that's critical. And so I want to give my appreciation to the moms who entrusted me with their stories very bravely. And I very much appreciate them. And that's it. Thank you.
How do I advance? Okay, Westagee Slee, good morning. Sagoli Swagwake. Hello, everyone. Carrie Wabanaskam yung get swagin yunta ni wagita loda, oniotiaga ni wagahunjoda, Okale Manamini Potawatomi Stockbridge. I just introduced myself to you in my Oneida language. I'm a citizen of the Oneida Nation of Wisconsin, and I'm of the Turtle Clan. We are a matrilineal society, and that clan was passed down to be my mother, my grandmothers, and all the mothers before. And so I am also of three other tribes in Wisconsin. I'm a Wisconsinite. I'm assistant professor at UW Green Bay, go Packers. So I'm here to talk to you about our Indigenous relative caregivers' experiences with the child welfare system. And if you've ever had the honor of listening to an Indigenous any Indigenous presentation, we have a specific protocol in how we introduce ourselves. And today I bring with you some of my relatives, my ancestors. These are my grandparents. My grandparents, many of them are survivors of boarding schools. Many of them have had, they've experienced what we all call historical trauma. And I am a survivor of intergenerational trauma. But I'm also a beneficiary of their intergenerational love. They wrapped me in our traditional kinship structures. And that's why I am able to stand here in front of you today and talk to you about our experiences with different systems, specifically the child welfare system. And I also have lived experience in this. I'm a relative caregiver. I am also a mother to 2 children, and I am an auntie to 8 nephews. And in my Oneida language, the word for mother and auntie is agnuha. There's no separation. That is our kinship. And so those teachings that they provided for me and modeled for me really informed how I walk through this life and how I take care of the children that are in my life. And so it also prompted me to look into the experiences because I knew there were shared experiences because we talk about them. We share stories. That's how we are. We're relational people. And so this is a paper that has been submitted and coming to a journal near you soon. And so I was really praying about how to start this paper. And so this is taken from the first line out of this paper right here. For hundreds of years, settler governments have violently removed Indigenous people from our mothers. First, we were forced from our Mother Earth, our lands. Then we were abducted from our mothers who birthed us, forced into carceral boarding schools, and adopted far away from our homes. And so these are really stories about removal. And I realize now why I was grouped with these two amazing people here, because there's a lot of similarities. I use some personal pictures throughout for copyright issues, but my little youngest nephew there, he's super cute. And so this is my qualitative study. You know, just like Darcy had said, we ask those questions. How do you experience the child welfare system? I'll get into a little bit more of that a bit later. But for some background, I took out all the numbers, the data. We heard about the numbers, the data yesterday and today. But what we do know is that Indigenous families experience high levels of child removal by the child welfare system compared to other racialized groups. And those high rates of removal persist after 40+ years after ICWA implementation. Okay. We say that there is ongoing colonialism or coloniality in child welfare, and I'll get into more of that. That is premised on separation, removal, and ongoing colonial violence. As that first quote that I shared with you, that was the opening line to my paper, removal has been and separation has been a practice since settlers first landed on our lands. And it started with the removal from our lands. And so this is not an ICWA presentation, but you all should be aware that ICWA is currently being challenged in the Supreme Court. And one of the things that I would like for you all to walk away from this presentation today is the understanding that we are racialized. Heard a lot about race and ethnicity over the last 2 days, but I didn't hear anything about much about tribal sovereignty. I am a citizen of a sovereign tribal nation, and that is what ICWA is based upon, not race. And so I encourage you, there is a Supreme Court justice that understands this, and he's one of the conservative justices. So I did put a link in there to some of his writings on it. That would be Neil Gorsuch. And so this study was born out of a scoping study that we completed in 2018. I feel it's getting a little old now, but we looked at the Indigenous child welfare literature, and we found that some of the disparities, and this was from the literature, you know, this is stuff that we talked about, but we also saw a glaring lack of literature that focused on lived experiences and Indigenous voices, those people who experienced the child welfare system. And then I also looked into some more recent some of these studies were included in our scoping study, but those studies that looked at those lived experiences and that implicated settler governments as perpetrating this colonial violence and harm. And so these are some of those studies that really are in alignment with the findings that came out of my study. And so I'm just going to dip a little bit into the history because this is not a history presentation, but this is some history of Indigenous child removal in this country. And also I talk about Canada because we don't recognize those colonial borders. I have relatives up in Canada. Those were forced upon us as well. And so we began in just a snapshot here in the late 1800s, carceral boarding schools. I don't even like to call them schools because we're currently, we knew this, but you know, the grave sites that are being uncovered, unearthed, and residential schools in Canada. So the focus was on assimilation, child removal, separation, kidnapping, abduction, whatever you want to call it, but assimilation. to white settler colonial culture, grounded in Christianity, English, individualism, citizenship. And I have a great grandmother who was on that first slide who could speak fluent Oneida. And she was in the boarding school. I was alive at the same time as she was. And the reason why I'm standing here speaking to you in English is because her language was beaten out of her. I wish I could be up here speaking to you fully in Oneida, but I can't. And so around the same time in the late 1800s, the Dawes Allotment Act was instituted. And what else I don't really hear talked about too much is land. The violence against our land is, it hurts us deeply, spiritually, emotionally. And so that's why we are fierce protectors of our lands and waters. Many of you may have heard of Standing Rock, okay? The Wolf River runs through Wisconsin. My family has been fierce protectors of the Wolf River against miners. And so, but land has always been central to the colonization of my people. And so the Dawes Allotment Act, which was instituted in 1887, that broke apart tribal, communally held tribal lands into private allotments, okay? Around that same time, and I don't have this on here, I took it out, but I do want to mention, because there's a lot of social workers in here. If you look into any social work history textbook, because I looked in a lot of them, you might see the name Anna Lawrence Dawes. I don't know if any of you have heard of her, but in the late 1800s, she was the first person to call for the professional education of social work. She was also the daughter of Senator Henry Dawes of the Dawes Allotment Act. And we also did some digging around on the some historical records in the Conference of Charities and Corrections, and found that she also was on a lot of standing committees with Captain Richard Henry Pratt. Do you all know who that is? The designer of the boarding school. So I always say that when the emergence of social work, these federal policies to control our people and our lands, and we're all wrapped up in with each other. And so you move on through the timeline. You had family education programs where people came out to the communities to train men to work those allotments. In the meantime, they were removing and separating our children, kidnapping our children, putting them into boarding schools, and then imposing the Western role of the woman onto our women to take care of the household. Okay. And then you move forward to the 50s, 60s, the Indian Adoption Project, the 60s Scoop in Canada. The Child Welfare League of America was involved in that. And that was forced adoptions. My uncle married a woman who is my auntie, who was forcefully adopted out. There's a woman, I call her Auntie Sandy Whitehawk, who has done a lot of work in this area. She's published research on her and many other adoptees' lived experiences and their repatriation home to their people. Okay. And some of the implications of child removal for us, Dr. Braveheart talked about historical trauma, historical unresolved grief, and intergenerational trauma. And so when I talk about colonialism, ongoing colonization, in our communities, we mean, you know, when we say that, we use these words interchangeably, but in the academic worlds, there's, you know, distinct meanings for each of these words. So I use coloniality in this sense. And so Anibal Quijano talked about the intersection of world capitalism and racism. And we all know what racism is, that biological construct that was imposed upon people to create this hierarchy of superior versus inferior. And leave it to a woman, Maria Lugones, to come in and say, hey, you're missing something. And so she talked about the modern colonial gender system. And she said that gender was imposed just as much as race and became this distinct dichotomous hierarchical logic. But it also became this human characteristic. And so that included that the white Christian heterosexual landowning man was superior to all others were aberrations. And all of this normative judgment provided justification for colonial violence among several civilization projects. And to expand upon that, Lasanova and Mignolo talked about the colonial matrix of power. And so in order to gain control and power over one society, from one society over the other, you needed complete erasure of the existing society. And I can tell you that when settlers came over here, they didn't come into a blank wilderness like some history textbooks will tell you. Complex societies existed here. How do you think settlers learned about democracy? It was from my people of the Haudenosaunee Confederacy. We were the originators of democracy. And so they gained power and control over these four spheres. Sphere one, economic control, control over land, very central. Control over authority, military, police, control over gender, family, sexuality, and that's where my research falls into this sphere. And control over knowledge. Sometimes we don't think about how knowledge is controlled in the, and I really became clear when my first year of becoming a social work educator, and how social work really erases Indigenous knowledge and marginalizes us in that sense as well. And so there's a term here that is decolonial thinking. Okay, it's breaking free from knowing and being under the colonial matrix of power to, quote, unlearn the thinking imposed upon us by education, cultural, and social environment, unquote. And Lugonis talked about sites of resistance. And I always say, you know, there's so many different ways we resist, okay? When my young ones are talking about gender in a different way, they are resistors. When they're educating me and breaking free from that heteronormativity, they're resistors and they're educating me. And so I'm going to breeze through my methods a little bit because I don't know how much time I have left, but I do want to get to the quotes, those stories, those lived experiences. And so I talked to 10 Indigenous relative caregivers. And so the way I define relative is also from that decolonial thinking, because when we think of relative, we might think of blood or some, you know, or kinship. We're taking care of people in our home. Some of the relatives here aren't necessarily taking care of kids in their homes. They're taking care of our communities. Because in many of our languages, you're going to find a word or a phrase that translates to "we are all related." And so many of the relative caregivers that I talked to have dedicated their lives and their careers to making sure that our kids don't experience what they have experienced. And so many of them also have lived experience in the child welfare system. And many of them have one boarding school survivor, okay? Many of them are also professionals, activists, leaders in their communities. So they had a lot to say about this, okay? I used Indigenous research methodologies. I can't go into that today, but you know, at the center, it's relationality. And it really guides how I interacted with the people that I talked to, that I engaged with. And the conversational method in Indigenous research also upholds that relationality. Now, I was trained in Western research methods, you know, I use those as well, but there were times when I just was like, no, I got to listen to the way I was raised, those values that I was taught to by my family, my community, and go that route, okay? And all this other stuff. I used a combination of Indigenous and Western data analysis, thematic analysis, because I wanted to see the relationships across the stories, but I also presented a lot of them in longer conversations or condensed stories as modeled by Maggie Kovach, who's an Indigenous scholar. And so the findings, I call that uncovering. I also call it truth telling because it's, I gotta get I'm gonna read some of them to you and I have them on my computer here. But as a good qualitative researcher, I didn't steer the direction toward any of this. I simply asked questions around what are your experiences in the child welfare system, okay? And so this is one of the quotes taken directly from one of the people I talked to. So we've been taken away since forever. Our people know this. These are their experiences. And so the first major theme that came out of this was the child welfare system perpetuates ongoing colonialism by forcefully removing and separating Indigenous children. And I'm gonna read this to you. There was a young woman named Sage who, I mean, just brilliant. I'm gonna read this to you. I feel like it's legal kidnapping. CPS has tried to take my daughter away from me. And had I not known my rights, they would have succeeded. I have had several doctors who I asked to look into the conditions that my daughter had that I felt were preventing her from thriving. Instead, the doctors told me that I was an overly concerned first-time mother and not to worry so much, only to find out later that they had called CPS due to the same concerns that I asked them to look into, stating that I was likely not feeding her. Within a couple of months, we fortunately found a doctor of culture who looked into my concerns, and they were able to get her on the right medications to ensure she would thrive. It was a fight to keep her out of the system, and one that my own mother lost and her mother lost, because not only did they not know their rights, they did not even know that they had rights. My mother and I were taken from our homes, our families, our communities to be raised by people who did not care to try and maintain those connections, nor do I believe that they cared about us, as both of us were removed from foster home after foster home, following our removal from our birth parents and having most of our relatives severed from our lives prior to our adulthood. And so she has that lived experiences, and she's also a professional. She's an MSW. And so another one here, the child welfare system perpetuates the modern colonial gender system. Okay, and so Kevin identifies as a two-spirit gay male, and two-spirit, if some of you don't know, is a term that is reserved for Indigenous people who identify as part of the LGBTQ plus community, but it honors the gender fluidity of both genders. Kevin has dedicated his life to protecting children from the system through education and advocacy. So I'll read this to you. I also speak about the child welfare system failing me because they continue to keep putting me back into a home where more violence was perpetrated upon me. At the age of 10, when I was emancipated by the court system, I was forced to go to a boarding school, and my experiences in the boarding school were not good. My own social workers, my own child protection program didn't know how to properly serve me. I was forced to see a psychologist who was more interested in changing my identity rather than talking about the trauma that I experienced. I don't really have good things to say about the system today. And Kevin has dedicated his life to talking about the intersection of Native Two-Spirit LGBTQ plus young people in the child welfare system. And that is a topic that we often don't talk about. It's ignored. And so I promised him that I would talk about it. And so a few others, the child welfare system perpetrates colonial violence through negligence, invasion, punishment, and racism. And again, we see Sage. I'm going to read this one to you. There are laws in place that should have to make it so that it's not like, I think about all the stuff that I've missed out on. Even getting back into my culture and getting to know my relatives is hard because I was removed for so long. I realize now that was part of the plan for removal, not just with me, but with Indigenous people all over Turtle Island. That's North America, by the way. I don't want the experience for anyone else because it's incredibly painful. Not only do you lose your relatives, traditions, and connections to your family and community, but you lose some of yourself as well. For a lot of us who were removed, we lose our sense of belonging, which plays a vital role in child development. And I realize now that is not simply, it was not simply lost, it was stolen, and that is the point. And so Lacey, who is another relative caregiver, talked about colonial violence through invasion. She said, I felt invaded at times because the worker had to come into my house and inspect my home. Now the government is involved and can enter my home at will and evaluate us. They had to inspect my house like I was the one who did something wrong. I get it, and I know they have to make sure the kid is going into a safe house and family, but as a Native person, I have a different feeling about this type of invasion. That feeling that my ancestors, as our lands were invaded, and we still feel like we're being invaded when outsiders come into our homes and they have control over our lives, it's stressful. And so Susie, another auntie, talked about how she avoids the child welfare system so they don't criminalize her sister. Okay. And then through racism. Andy is also a professional in county child welfare system. And she had an experience with a police officer. She's also a relative caregiver with children in her home. She had an experience with a police officer who told her she had nothing to worry about because she works for the system. And she replied, "Let me reiterate, I work for the system. I am a person of a color. I have every reason to be afraid." The child welfare system is a colonized stressor that triggers historical trauma. And so Lily is one of those community leaders and advocates, and she was helping a grandmother navigate the child welfare system. And I'm going to read this to you. When she calls, she gets all kinds of triggered. And by triggered, what I mean is that dealing with the system is a historical trauma trigger because they use words like removal and they use tactics around fear. How are we supposed to engage in healing if we don't ever stop to think about how we're perpetuating these traumas over and over for Native people? And so I love my people, but I don't want to let them off the hook either, because we do it to ourselves too, sometimes. And so one of the quotes taken here, "We are doing the work of the colonizer, tribal communities perpetuating internalized oppression or internalized colonization." Okay. And so Betty is an elder who is also a social work educator and a relative caregiver. She talked about how she's noticed that how when families become distrustful, the families continue to be distrustful and they watch the Indian social workers. If they do something that looks like unfairness, the families feel like they're becoming a county worker. And she was really talking about how oftentimes we mimic state and county systems, and that leads to distrust and more harm and trauma. And Kevin again talked about this here. So I even believe that our own system shunned two-spirit identity because the identity was lost because of colonization. So I'd like to leave you with a few quotes on decolonial child welfare because they talked about that too. And let's see here. Oopsie. That's me and my daughter a while back. And so this one, the word delinking, it's kind of like that delinking, decolonial thinking from colonial child welfare practices and worldviews. And so Lily really gave us this really important teaching that has been really profound for me and many others. And she said this: if we're truly going to look at the current system of child welfare and we're going to say, well, how are we going to apply an Indigenous or Native or Anishinaabe worldview to how we center around children, then we would put that child center, right? And then by that, we're going to say, okay, not only the child, but the mom and the baby. How would we center them? Because they can't exist without each other, right? So removing babies and children from mothers and then expecting the mothers to get healthy separately is opposite of what we know to be true. We're further disconnecting them from the source. So even thinking in terms of the umbilical cord, that connection, that umbilical cord connects them. But in some cases, I guess if it's going to come to an actual removal, there needs to be some sort of ceremony of passing over guardianship, where we are letting the spirits know that now I'm the mother. There should be a better process for that, but there isn't. And so she was really talking about how removal is violent and traumatic. She's experienced that with the kids that she takes care of in her own lives. And, thinking of ways that, what could be done differently today. And Sage left us with this here. And so Sage started talking about decolonization more in depth. And she said this here: I feel like if I'm not trying to work myself out of a job, I'm not working ethically. So yeah, I'm definitely here for the abolition of child welfare. We have and have had our own systems, not child welfare, but our own systems. That's what I mean. by going back to what we had, our own systems that I talked about earlier. There was no court. There were no white man's laws. There was community and there was family. And we were free from colonial violence. Child protection started as a way to assimilate, and it started as a way to kill the Indian, save the man. We already kept our kids safe before settler colonialism. They are not safe now. They're not safe in the system. Our culture, our language, our concepts of family, our ways of thinking are nowhere to be found in the system. Our system is written by colonizers to maintain control, plain and simple. And so that was, I leave you with that to think about. Because in many communities, we might use different terminologies, but I've worked with many tribes across Turtle Island, and many of us are trying to get back to reclaim, revitalize what was taken from us, what was stolen from us. And I challenge you all to think about that too. You know, I teach social work education now, and it's riddled with white saviorism. And so I'm trying to flip that script with the students that I have now, is learn about tribal sovereignty. And when you're writing your research papers too, because I'm considered an early career scholar, and I've been reviewing doing peer reviews, and I'm like, okay, the same old thing when people are writing about my people. Like, you need to write about us in terms of tribal sovereign status. And also, what are we doing in our communities right now? Because we're doing the work. We have the knowledge, we're doing it. And so if you want to join us in any efforts, there are many friends, you know, people that we consider relatives who are doing the good work. How are you supporting that? Okay, and so this is just a graphic, everything that I talked about that is going into, and I want to just quickly call your attention. I'm probably out of time, but you know what? It's all good. So that resisting, identifying, and so I follow, there's a Dakota scholar, her name is Waziata Win. She talked about, we need to first identify and uncover the way that colonization has seeped into and impacted our people. Because a lot of times it's hidden and we end up maybe even doing it to ourselves. Okay, so identifying, resisting, reclaiming, reawakening, whatever word we use in our communities to try to get that back. Okay, because we were, when I talk about colonization and in the broader terms of social welfare as well, you know, poverty didn't exist before colonization. I heard a lot about poverty. Do you think about that? It didn't exist because we were self-sufficient. Our land took care of us because we took care of our Mother Earth. How do we get that back? There's a lot of efforts in trying to get that back right now, I can tell you that. So discerning what has been imposed upon us to further determine what we need to reclaim or revitalize, decolonize. And I want to also point, thinking about the self-determination of tribes. Okay, each tribe is very different and might be talking about these things in different ways, and we need to honor that as well. Okay, and I kind of talked about this too. Yeah, so paper 2 is going to talk about that Indigenous kinship, going more into that and how we became forced reliance on the social welfare systems. And then a third paper that's going to come out is looking more into what does decolonial child welfare look like. Okay, that's my son and I thank you very much.
Mike. Thank you, Danielle. I just want to center us a little bit because listening to this can really stir us up. And for many, many reasons, some of us might feel very connected to some of these stories because it reflects our own background. Some of us might feel challenged in an uncomfortable way by it. Some of us may not have known some of these things. Some of us might feel like they don't want to connect with it. Lots of feelings come up whenever you have this kind of presentation. And so I just wanted to make that acknowledgement. If we were in a different space, I would be having us do a debriefing, but we're not in that kind of space. But I want to say it was very intentional. I was the one who pulled this panel together. And I have lots of colleagues, as my colleagues here know, who take a different tack on this. But because I wanted us to really think carefully about this and how it affects our capacity to do research with these populations, our capacity to even engage them in this work. Because really, when I think about some of the experiences of some of our families, if I was approached about being in a research project, I said, absolutely not. And we're going to hear that and see that. And so I think if we really work hard to internalize some of the messages that my colleagues have gracefully shared with us today, and we use that to connect with parents and to approach them, and we really use that to inform how we think about our research, the design, the interpretation, including the voices, all that kind of thing, then we will do a much better job of reflecting not only their experiences, but all the outcomes that we're looking at. So I wanted to kind of put that on the table for us to sit with before I go to questions, just for a second. So with that, any questions coming from the virtual or in-person audience? Mhm.
Thank you so much for an absolutely incredible set of presentations. One of the things that really struck me as you were talking about is the parallel history and experiences of people who are involved in the carceral system in the US, and how that is another way that parents are forcibly removed from their children, because most incarcerated individuals are parents of minor children. And the statistics are that 1 in 9 Black children has experienced the forcible removal of a parent because of incarceration in the United States. And that's a resident parent during childhood. And so I just want to really think about that. And only, most incarcerated parents are fathers, and only about 2% of the kids with incarcerated fathers are in the foster care system. And for incarcerated mothers, it's about 11%. So these are somewhat overlapping system, but not as much as you would think. And so I just would like to hear your thoughts about that.
I could be brief on that. I consider them the same system. The child welfare system is part of the broader carceral state. So whether parents are being taken from their children through the police, children are being taken away from their parents through the child welfare system, or what many of us call the family policing system, the systems were designed for the same purpose, to maintain the hierarchy that exists in the country now with white people at the top. So they just act in different ways to keep Black and brown families down, but the methods that they use, surveillance, regulation, punishment, they're all the same and are for the same purpose, just slightly different ways of going about it.
I would just add that we should also be mindful of how the education system plays into this, as well as a pipeline to both child welfare and carceral system, because it is intertwined. And so the calls come through there. And those are well-documented pipelines into this continued surveillance and oversight.
Thanks so much for those wonderful presentations. That was just, and really, really thought-provoking, and really appreciate the time and attention and the historical perspective that you all gave. I am wondering, Alan, if you could talk a little bit about, I think one of the things that I'm taking away from this meeting was the importance of language. And, Darcy, you talked about yesterday, really precision in language and what do we mean by maltreatment? What do we mean by abuse? And Alan, I'm wondering if you could reflect a little bit about what do we mean by separation? And the range of experiences in terms of forcible separation. And how do we unpack that in some of our understanding of the variability of the circumstances under which a separation could occur. I would love to just hear you talk a little bit more about the constellation of things we have to consider around forcible separation.
I use the term forcible separation or sometimes involuntary separation or even state sanctioned separation intentionally to not use the word removal, which I think is the term that the system has given us, which is, I think, kind of intentionally devoid of trauma. Removal sounds like it kind of happens without it being imposed on a family, whereas separation is something that's done to a family. There are probably, I mean, some people use words like kidnapping, state sanctioned kidnapping, which I think you could make a case for. I've found separation to be the term that best captures the function, that it's imposed upon rather than what some people think of removal as being just something that happens to a family. Teresa, did you want to add to that?
Yeah, well, I just have a question / comment, and I do want to acknowledge what because people don't understand how this is secondary trauma for us. And people just think this is numbers, and it's not. And folks I heard me, including the researchers. And I don't even want folks to waste their time trying to convince people that this is racist. We can use a better use of our energy and time. You need to get this information out to the communities. You need to get it to early social workers, because I don't know when the last time practitioners or folks in communities have read a peer review article. And if we want some changes to come, we probably have to change our audience. We probably have to change who you're telling this story to if we want real change. This is hurtful. And it's not okay. And no one should be okay in this room right now by hearing this panel. I'm done. I got more to say, but I'm done for now.
Thank you, Tyrus. You're going to make me tear up as well. And so I was talking to colleagues this week. I was talking to Alan, I was telling people, yeah, I'm a scholar. I have benefited from all the white supremacy bits myself in order to be sitting here in front of you. But I'm still a Black woman. And so amongst my colleagues, I need for my white colleagues to understand we're all people of color on this panel. Tyresa and I are Black women. Yes, we're in the academy, but we are part of those communities that white folks are developing oftentimes erroneous narratives about. And interventions and things are happening to our communities. We're still part of those communities. And that's why tears are they just come. And that's okay. But please understand, this isn't really our work. This is your work. Go tell people that harms are happening. And just because we made it to this position doesn't mean we're not harmed. I mean, I was struggling yesterday. I was struggling because it's just glossed over. Here's a prevalence rate. Here's an outcome. It hurts when nobody's paying attention to what we just presented, really. I'm grateful to have been invited, but yeah.
Well, if I could just say one thing. First of all, Tyresa, thank you for being brave enough to share your tears with us. That's not something we often see in scientific work. And I get nervous when we don't give space for that. And I'm extending my arms to you across the tables. I do want to go back to what both Carrie and Darcy said though, about our own privilege and about as women of color who are researchers colluding with this, I will tell you all that the one thing that I carry with me is humility all the time. And my team, Danielle is here, knows that I talk about this all the time. We defer to these participants. We defer. And part of the reason that I give that message, and they now can repeat it, is because I want them to know that I'm trying to work on my privilege. I'm trying to not be part of a system that continues to subjugate and oppress them. And I'm constantly working on it. And I want them to know that. And I feel strongly that if, and I'll just focus on HBCD for a minute, that if we're gonna carry this study out in a way that really gets to that, population of parents that we're trying to include, that we have to lead from there. And I think we need to think about that as researchers. And I think we've got some good examples of people who have done it, and we need to internalize some of those things. And be ready to, understand that if this can affect Teresa like this, what is this gonna mean for our parents with lived experience of all the risk factors? I won't even go down them, but all the risk factors that we've talked about today. Dee, do you wanna make a comment?
Certainly. I'm sitting here as someone who has lived expertise, lived experience. And I can't tell you how I'm feeling in the moment. I'm very emotional because I'm hearing what you're saying, Dr. Allen, as someone who has been impacted, but also has done this work in terms of, integrating that lived experience into the child welfare system to improve outcomes for children and families. I have this tension of like, what is my role? Is my role causing more harm? Am I being part of the problem instead of being part of the solution? And that's something that I constantly think of every single day in this work. But then I also know if I'm not a part of this conversation, still harm is being done to the people and the families that look like me. And so, I wrestle with that. Maybe part of being a part of this, as a lot of us who have lived experience, is to maybe dismantle piece by piece, and maybe think about hopefully one day having something, not a system, a framework, if you will, of well-being that will, support children and families and maintain them in their communities. And so I wrestle with that tension, even as I'll be presenting later about a participatory research project. I just wanted you to know that I so feel, I just can't help but just feel so emotional about what you shared, and also what Dr. Washington shared yesterday, because I grew up in kinship care as well. And I also had, as an adult, had a child welfare experience, just trying to get help for my son who had mental health exceptionalities, and there was nothing in our community to support him. So I got thrown into the child welfare system, me and my family. And even if we weren't separated and there wasn't a separation, if you will, it still was traumatic nonetheless. And I want to hold that up, as well as, all of the things that happened afterwards that, supported my family and helped my family. But I want to honor the trauma and the pain, and this is 20 years later, that still resides in my spirit. And this is the reason why I do what I do, so that hopefully other families don't have to experience the traumatic experiences that myself and other families have experienced through this oppressive system. Thank you.
I just want to honor the emotions that are going on in the room. We don't often experience this in academic settings. And to me, I have two kids. I have a 21-year-old and a 12-year-old. And when my 21-year-old was 2 years old, I was crying and he told me, "It's okay, Mama, tears are good medicine." And that's the way we heal. And so we also believe that our kids are straight from the Creator's world. And so I knew that he had that message for me and that knowledge. And so that's how I see it now. And I honor those emotions and those tears. I am sitting here over the last 2 days. I leave my family. And like I said, I'm a Agnulha, I'm an auntie and a mother. My oldest nephew just got out of prison. I had to leave. I'll have to come here. I'm gonna be here until June 2nd. But I step out and I call to see how he's doing because he's in a very vulnerable situation right now. The first place he came to was my house. Because like my grandpa that I showed you on my first slide, I strive in this life to make my house a safe haven for our kids and to raise healthy Native kids. And so when he was over, he said, "I don't want to leave your house." And that was the biggest compliment that I could have gotten from any of those kids. Or, "Auntie, I feel safe at your house." Because that's how I felt at my grandpa's house on the Menominee Indian Reservation. And so I'm sitting here with that and I'm holding on to that. And then I come here and I tell these stories. And so it's heavy. So I appreciate the emotions that are here because it feels like it's giving me a connection to you all because we're struck by that. We have this emotional response and we can let those tears out as a form of healing and connection. So I appreciate that.
I want to acknowledge quickly, since we're talking about this, and since it doesn't often happen in academic spaces, part of the reason why this brings up so much emotions for us as panelists and for people in the room is because it's a struggle to get this information out. Everything that we presented here today should be common knowledge, commonly believed facts about the system. But as we're up here presenting this, there is an active group of child welfare researchers in the field writing papers trying to convince you that racism is not a problem in the system. They'll run statistical models and they'll say things like, when we do these statistics, racial disparities disappear. And actually Black children are underreported and they need to be surveilled more. That's the kind of work that's being done in the field now. And we have to get past this idea that when we know that we live in a racist society with all of our systems with the racism embedded in it, that somehow the child welfare system is exempt from that racism and it just doesn't exist in this system. That's why it's harmful to us, because we have to read these studies that people keep putting out. Studies that say that foster children on average are satisfied with their experiences in the system. That's what other people in our field right now today are doing. And that's why this is so traumatic, because we can't just get to a place where we acknowledge racism is just an ordinary everyday experience in the system.
I want to reiterate that it's really quite harmful. And that's what gets me very upset on a consistent basis. And that's why it's really important for me to share the narratives and the stories, the lived experiences of how my community members, my sisters, have to navigate the world. And it's not fair. And I feel like we just theoretically, academically know there's a problem, but all we do is just read the words on the white paper and we don't actually digest how people are experiencing these things. I've got so many stories that should have everybody in tears all day long. And so, yeah, it's hard for us as academics to share, because it's just people don't want to, because it's a racist system and we're people of color. So why would we be believed first? Why?
really do think that when these kind of things come out, you need a chance to regroup and pull yourselves together. Just to sit with it, but I do just want to say two final things. One, I want to thank the panel for pushing us in this area. And I want us to take this seriously. And, again, I'm focused on HBCD, but I think this is broader than just HBCD, that if we're really serious about getting the voices of other families into our work, we have to rethink this. We have to internalize, if this is happening to privileged people who have education and PhDs and all this kind of stuff, we gotta think about how this affects the families that we want to pull into our studies to make them more reflective of what's really happening. And certainly, I think for HBCD, where half of our sample, these are things I've internalized, half of our sample have to be from backgrounds of high risk, we have to pay attention. We have to pay attention. So with that, I hope everybody goes get something to drink, goes do some self-care, breathe, all the things that, we tell families to do. I think we should do it for the next 15 minutes.
Hi, and welcome back. We're going to get started with our final panel. So I just wanted to say a couple of words before I introduce our panelists. So we've heard so much important information, and it has really moved us. And it's important to hold on to that and carry that forward into our work. As we move forward with humility and being able to deeply listen to and honor the voices of people with lived experience who actually are also participants in our research. And so for the past 25 years, I've been studying children who have a parent involved in the justice system, children with incarcerated parents. And I feel like so much of what I've learned, pretty much everything I've learned, has come from people with lived experience, from children, from their parents, from the individuals who care for children in their homes. And my job is to amplify their voices and educate people about their strengths and their struggles and how the system has failed them. So I just want to encourage people who are doing work in this space of including people who have had impacts of the child welfare system on their lives to make sure to amplify the voices of lived experience and deeply, deeply listen and educate others about what you learned. So today we have 4 panelists, and instead of taking an hour and a half, we're going to take about an hour and 20 to 25 minutes. Each one is going to talk for about 10 minutes about their work, and then we're going to have time for the panelists to respond to some questions that we brainstorm in advance, and then also open it up for questions from the audience here and in Zoom land. So one of the panelists is Dr. Merritt, who's a professor at the University of Chicago and just presented. And so we'll get to hear more about her work that really centers on the lived experiences of families who've been impacted by child welfare. And then we will have Dr. Lonnie Berger, who's the Associate Vice Chancellor for Research in the Social Sciences and the Vilas Distinguished Achievement Professor in the Sandra Rosenbaum School of Social Work at the University of Wisconsin. And he has done extensive research that has as its goal to inform public policy and help families in accessing resources and promoting positive child development. Then we have Dr. Hak-Soon Ahn, who's an associate professor in the School of Social Work at the University of Maryland, who's done a statewide evaluation of child welfare services and policies in Maryland. And then Dee Bonnick, who's a parent consultant for the Children's Trust Fund Alliance. And her work is really trying to transform the front end of the child welfare system. And she also won a social justice award from NYU, where she did her master's degree. So I hope that we can stay engaged. This is the long haul. And following this, Dr. Jones-Harden will just give a couple of words of closing and then we will be done. So please welcome Dr. Merritt.
I am back. So it's been an enriching 2 days. So I just want to acknowledge that, and it's hard conversations, but we have only 10 minutes. So I'm just going to get right into it. So I'm going to be talking about, again, acknowledging racism and racialized poverty surveillance, and then how this impacts actually families. So experiencing poverty and racism is unintentional, and the consequences of these experiences should not be blamed on parents that are just trying to raise their families to the best of their abilities and their resources. Parental behaviors and their intentions should be considered as a function of their available resources and histories of structural discrimination and in their environmental contexts. Parental behaviors related to poverty and oppression should not be deemed maltreatment, in my opinion. I believe that we should have severe policy revisions that mandate a non-judgmental approach from the beginning and throughout the course of systems involvement. Racial bias awareness at the point of screening in cases to investigate is imperative, and it should always include ways in which people are held accountable for not constantly assessing how their biases play out and impact the decisions that they're making about the lives of children and parents, including the notion to place them on the roles of CPS oversight. So I'm suggesting with my work a renewed effort to support and empower these parents and decrease punitive oversight. So poverty, particularly extreme poverty, is in fact a form of trauma, as we know. It results in a host of deleterious outcomes, such as poor functioning and suboptimal behavioral choices. Risk factors that result in increased CPS oversight are generally outside of the control of the parents, primarily because of their positionality in society. So sadly, this results in a number of a higher likelihood of initial CPS oversight and surveillance. Once the surveillance begins, it's a wrap. It's a problem the very minute a call comes in. So we have lots of research that documents this relationship between poverty and maltreatment, but less so considering the impact of racialized poverty, which is different. So as I noted in my previous presentation, I've documented a lot of qualitative accounts of the lived experiences of Black families who have perceived racial biases in their interactions with the CPS professionals. And these parents overwhelmingly have reported feeling judged, disrespected, oftentimes misunderstood. So here are some accounts in these following slides that illuminate what racialized poverty looks like and neglect in relation to poverty and in relationship to their experiences and the narratives. This person says they don't know if I just think if you're a minority and you have an ACS case, they have a certain perception of you. It's like a stereotype. And they think that you all are the worst type of parent. And this is, of course, all the names were changed, but this is Bianca, who is 28 years old, who had one child. This person, this next quote speaks to colorism, which is also a real thing. And she's highlighting the fact that skin means a whole lot. If she was light enough and white enough and bright enough, folks would be a little bit nicer to her. But because she's dark and she's got stereotypes on just based on that skin type, that skin tone, and she's perceived as aggressive. So racialized poverty, it can't be disentangled, as I said. Neglect can't be disentangled from race and poverty. So we have to think about the intersection of these populations of color with regard to low socioeconomic status that results in this over surveillance. The surveillance is problematic in itself, but we're talking about over surveillance, which includes biased judgments regarding maltreatment risk. This intersection can be understood as racialized poverty in the US, especially associated with Black African-American families that are involuntarily living in poverty. Raise your hand if you want to be poor. And I'm not talking, if you're living off the land somewhere, I'm not talking about those, but raise your hand if you actually want to be poor. Nobody wants to be poor. Okay, so this is all intentional. And so they are under the surveillance of folks because they are raising their children under poor conditions that they did not choose. And they are systematically disenfranchised and generationally as well. So it's critical that we acknowledge that their experiences of poverty are intensified by this structural racism as well. And that includes mandated reporting from school professionals and others. Most of the reports come from professionals in medical settings and in school settings as well, and law enforcement as well as that. We need to consider how are folks coming under the watchful eye of people who are then mandated to cause trauma. The laws mandate that trauma is caused by making reports when again, I'm going to keep saying, I'm talking about unintentional neglect. I need to make that clear. So we have to have more scholarship that examines how the surveillance impacts their lived experiences, because this racialized poverty shapes these negative perceptions about people, and it just perpetuates. And these perceptions are then embedded in all of the institutional procedures that we have and the policies that are responsible for protecting kids. We cannot disentangle neglect from poverty or race. It's just not appropriate. And so child protection from physical and sexual abuse is a completely different approach, as I said. I want you to think about also what we mean when we say minimally adequate care. We must really consider financial well-being. Who decides what a minimal adequate care, what that looks like? We have to consider that as well. Who made that up? So we need to think of interventions that address the harm from abuse. And we're not talking about unintentional neglect. We need to think about what contexts are optimal parenting. What context what does that look like for optimal parenting to be happening with these families? Here are some other quotes about parents. Parents want to take good care of their kids. This mom says she doesn't worry about being a parent. She worries about being able to provide for her kids, basically. She just wants to provide for them and give them what they deserve. And then another parent mentions how living in a low-income neighborhood is really problematic. And she sees all of the children that don't have what they need. They don't have their necessities. And so she's feeling badly about not having the proper education so that she can do well for her family. These narratives matter. Poor Black kids and their parents matter. As I said earlier, numbers and data are science. I get it. We all get it. But so are personal experiences of lived experiences. And we need to think about these qualitative accounts, and they need to accompany the quantitative data for a comprehensive understanding. Nobody's saying either or. Nobody's saying that. And we need to consider poverty as a function of racism for some people, for some groups of populations. And this then impacts the risk factors, it impacts the protective factors and the reporting trends. So many Black kids are poor. Why? Well, just start from the beginning. Let's think about the etiology of why certain groups of people, why certain populations are plagued by certain, injustices. If we start there, then maybe we can move forward to thinking about a solution of some sort. And one of the impacts that I try to point out, I look for the impact of child welfare system, CPS, on parents, and a salient impact that I've identified in my research is a lack of dignity. And here you can just look at these quotes, and I'm going to wrap up really quickly. I'm a little exhausted. So This mom is talking about needing a washer and dryer because she's in a Title I school. And they needed a washer and dryer because they couldn't wash their clothes. And that's very stigmatizing for her. The second quote really struck me. I remember talking to this woman and she was very upset because the social worker would come and admonish her for not having fresh food. Why don't you have fresh food? Fresh food is for privileged folks. She was making good decisions because she had frozen food, which would last longer so she could feed her children. Fresh food is expensive and it dies quickly. It spoils quickly. But yet she got in trouble for not having that privileged life of being able to go to Whole Foods, which I call Whole Check, and get fresh fruit every other day.
Thank you. So I want to start by saying how moved I've been to be here today and yesterday, both intellectually and emotionally. And this has been just, an incredibly touching and provoking conversation that I am grateful to be a part of, and I am grateful to have my research and my voice included in. That said, we're going to have sort of an abrupt shift in the type of research we're looking at. So what I want to say is, and I want to echo what Brenda said, Julie said, Darcy said most recently, there are different types of questions and different types of evidence that I think all need to be brought into the conversation together. Lived experiences, quantitative probabilities, are complements, not substitutes. And I think we need to bring these literatures together if we want to get policies and practices right to benefit children and families. And so what I'm going to speak about today is a very, very specific set of quantitative questions. And so I want to be really clear up front. So I'm going to look at, once kids enter foster care, what does the literature tell us about how that affects their developmental trajectories on a particular set of domains of life outcomes, right? This is not denying the pervasive racism throughout our society, of which the child welfare system is one microcosm. This is saying, given all of that together, once a kid enters foster care, and given all of their experiences, how do the probabilities or averages change in a particular set of outcomes? I also want to comment on quickly language. So my slides will say CPS involved. So Darcy brought up the point yesterday about CPS impacted. That's a point well taken. I submitted my slides Tuesday. I may have thought about doing them differently had I not. And I will try to use impacted language, although I'm so used to saying involved. We'll see how it goes. Okay, so the real question that I'm focusing on is, does foster care adversely, causally impact a set of outcomes, right? Beyond the correlation, beyond what would have happened without foster care. So I'm not speaking to people's experiences. I'm simply speaking to, on average, what do we see as the effects of foster care? Okay, so let me, good. And so here is the question, right? So do CPS involvement, do out-of-home placement, do aging out of care cause children, youth, adults to have worse life outcomes? And so it is well established that kids who experience child welfare, that kids who experience out-of-home placement, that kids who age out of care have really bad outcomes on average, on almost every domain we measure. Socio-emotional, lifetime earnings, education, probability of being incarcerated, almost anything you can name, they're going to do substantially worse than the average kid. Notably, there is likely, and some research addresses this, a lot of heterogeneity in there, right? So there is a lot of difference by your experiences prior to, during, and after foster care. There's a lot of difference potentially by, risk and resiliency factors. There is differences by the timing, the developmental stage at which things happen. Not all of that has been unpacked. So why is this question really important, right? So if the case is that other risk factors are driving these poor outcomes, right? So if it's things that happened in society, in your context, in your family, that are different across kids that experience these impacts of CPS involvement, then these poor outcomes may either demonstrate that CPS is not compensating for pre-existing disadvantage, right? Whether it's making it worse, making it better, or doing nothing. And that policy and practice really should be targeting what's happening before kids become CPS involved. And this is really important, right? The second piece is if these outcomes are made worse or are caused by CPS, then we really do want to think of that's the time to intervene, right? How do we try to make this system improve the lives of people who touch it, or these systems improve the lives of people who touch it? And both may be true, by the way. But I think there's a really important piece of thinking about, is this a marker of kids that are already on a trajectory that's likely to lead to adverse outcomes, or is this the cause? Okay. So I'm going to start with a quantitative lesson. Counterfactuals matter, right? Counterfactuals matter a lot. And so there have really been three types of studies that have tried to address these questions. So the first is between group analyses. So let's look at kids that were not CPS impacted versus kids that were, or kids that were not removed from home versus kids that were, or kids that didn't age out of care versus kids that did. And so what you do, you try to control for as many background characteristics as you can observe. These studies find very, very large disparities in life outcomes at, in childhood, in adulthood. Notably, there's only so many things we can observe in any kind of quantitative data. And so this includes the propensity score matching studies where you try to match kids. We can't observe, the extent to which people have experienced a range of ACEs, the degree of maltreatment or not, the way experiences have been internalized, et cetera. So there's some big limitations there. Second group of studies has looked at within group or within individuals, right? So this is saying, let's compare change from a kid's socio-emotional assessment, cognitive assessments before and after experiencing CPS or experiencing out-of-home placement. So they say, so by adjusting for that initial measure before this particular experience, you're essentially accounting for what happened prior on that initial measure, right? So you're adjusting for things that affected socio-emotional well-being before the kid went into foster care. These studies tend to show very little, if any, effects of out-of-home placement. Essentially, that kids on socio-emotional and cognitive measures, et cetera, particular set of measures, are doing about the same prior to and after foster care. One problem with these studies is there's really not much data you can use. So NSCAW is the one that's been used most. And secondly, some measures, some outcomes don't occur over and over. Some things are a one-time occurrence. Did you have a teen birth? Or, they may have multiple, but there's a yes, no. Did you graduate high school? Did you have et cetera. And so those are the kinds of things that aren't very well suited to this kind of analysis. The third, that arguably is the most rigorous way to detect a causal effect of an event, are these natural experiments. So these are instrumental variable studies. And so what these do in the simplest terms is kids get assigned child welfare workers, right? And they generally get assigned on the roster, who's up next, et cetera. And so child welfare workers have different propensities to remove kids from home. So some workers may remove 10%, some may remove 20%, et cetera. And so what these studies have done is say, we're going to take that random variation in the propensity of a worker to remove and say, had a kid been assigned this worker instead of the other worker, they would have been less likely to get removed. And what would their outcomes have been, right? And so what this studies have found very mixed evidence. So there was some very famous studies, Joe Doyle pioneered this. that found if you were assigned a high removal caseworker, you had much poorer outcomes in adulthood in terms of employment, criminal justice involvement, teen pregnancy. So that was using data from Illinois in the 1990s. So there have been 3 recent studies using data more recently in the 2000s from Rhode Island and from Michigan. And those studies have found much more mixed findings. So the BALD study is Rhode Island. And what they find is that for girls that are removed from a home at young ages, they do better in school. They have better test scores. They are less likely to repeat grades. For boys and older kids, there's essentially no differences. The Barron and Gross studies and the Gross and Barron studies essentially find improvements. So less arrest, less incarceration, less conviction, some higher educational attainment. So very mixed literature here. One thing I want to note here is that these estimates, while they're rigorous at getting at the causal effect, they only apply to the marginal child. So they only apply to the kid who would have been removed by one worker, but not by the other worker. And so that is a particular group of kids who are likely the least severely abused or neglected or et cetera, who are also likely to have different types of foster care trajectories. Okay, and so we need to keep that in mind. So a really good strategy, not very generalizable. Doesn't say anything about, on average, the kid who would have been removed by both workers. And so that's what I'm going to turn to next. So really hard to get good child welfare data where you can observe kids prior to, during, and after foster care, where you have big samples of kids in CPS and not in CPS that are somewhat similar. So we are very fortunate in Wisconsin that we work very closely with the state agencies, and the Institute for Research on Poverty essentially houses and harmonizes all of the state social welfare programs data, right? And many of these data sets, so I put 3 slides at the end explaining the data that I'm not going to show, but if people see the slides, many of these go back to the early 1990s. And so these are the entire populations of children in CPS receiving any type of cash benefit. We have all of their parents' earnings. We have all of the in-kind assistance, including since about 2009, all of their Medicaid health records. We have their child support. We have their parents' incarceration records. We have their school records. So this gives us a really comprehensive sample to look at outcomes that are measured in administrative data. And so what I'm going to show you is a series of results from a series of papers where we're using different counterfactuals to follow kids either across groups or within groups over time on this particular set of outcomes. I'm going to spend a little time on one example and then I'll summarize the rest. So this is from a pediatrics paper. And so what I'm showing you is we have 5 groups here because we can observe these kids over time, and kids take assessment tests, standardized tests in school every year from grade 3 to 8 in Wisconsin. So what we're seeing is all the kids at school, in public schools, grades every year from 3 to 8. And so I've divided these into 5 groups. So kids who received SNAP food stamps, but had no CPS involvement or impact. Kids who had CPS, an investigation, but were never placed out of home. Kids who were investigated by CPS weren't placed out of home yet, but we're going to be in the future because we can see that. Kids who were placed out of home in the past, but are back at home during the test. And kids on the bottom who were in out-of-home care during the test. So a couple things to note. On the left, the unadjusted. So these are average test scores. 0 is the average kid in Wisconsin public schools. So the top group is kids who received food stamps, their families did. They are about 0.5 standard deviations lower than the average kid. That's a really big effect to begin with. Go all the way to the bottom. Kids who are in out-of-home placement during the test are about 0.85 standard deviations. Really, really big, considerably bigger than the food stamp group. Although about 75% of kids, families were receiving food stamps before they become CPS impacted. So you could think about, on average, about 50% to 60% of that gap, probably reflecting economic disadvantage. Second thing I want you to notice is the kids who were screened into CPS, but not removed from home, but are going to be placed later, are the kids who are actually have the lowest test scores. So let's move to the second one. So the second one is adjusted characteristics and test scores. So now we're going to control for some background characteristics, and we're going to look at their test score in the year prior, right? And so what essentially happens here is almost all of the groups are still differ from SNAP. So kids who had no child welfare interaction. Interestingly, the kids who are in foster care either before or after the test are doing somewhat better on average than the kids who had CPS involvement and no foster care. If we move to the third set, so this is within child. So now we're going to look at the same child scores in these when they are in these different categories. And what we essentially see is there's no difference between kids who were out of home during the test and kids who were in OHP before the test, screened in, et cetera. The big differences are two things. The kids who are out of home during the test are doing slightly worse than the kids who are in SNAP only. And the kids who were screened in and placed later are doing significantly worse than the kids who had SNAP only. So the big takeaway is, on average, the test scores are lowest for kids who have not yet been removed. So I'm going to talk now similar types of strategies, a bunch of different outcomes. And so what I would argue is on test scores, that kids are at who go into foster care are at high risk of having low test scores. It does not appear that going into foster care significantly worsens those test scores. It is one outcome. So we've done a bunch of other papers. So if we look at teen motherhood, so what we see is really high rates of teen motherhood among kids who become CPS impacted and those who go into out-of-home care. Your probability of becoming pregnant is highest before CPS involvement. It decreases with a CPS investigation. It decreases a lot more while you're in foster care. When you leave foster care, it inches back up, but it does not go back to the initial risk rate. Educational attainment. The longer kids spend in foster care, the higher their probability of graduating from high school and the higher the probability of enrolling in college. Now, if you compare them to average kids, they have much, much lower rates of high school graduation or college attendance. That doesn't appear that foster care is significantly changing that trajectory and lowering it. We also see that kids who age out of foster care are more likely to graduate high school and to enroll in college than those who reunify. Earnings, again, longer duration in care is associated with greater earnings. This whole group has low earnings, right? And those who age out and those who reunify have very similar earnings in their mid-20s. Finally, on incarceration, so youth who age out are substantially less likely to go to prison than those who reunify. And this is a particularly pronounced effect for Black kids. So, big takeaways. All CPS involved youth, including but not limited to those experiencing OHP or aging out of care, are at risk of poor educational, social, and economic outcomes. This is a really large gap compared to non-disadvantaged youth. It is also a gap compared to other low income or disadvantaged youth. The gap's not as big. CPS involvement, OHP, and aging out don't appear to be the causes of these poor trajectories, and in some cases may lead to some improvements. I want to be really clear that this is a particular set of domains. There are many other domains that haven't been rigorously examined, and thus far we don't know the effects, right? I also want to be clear that these findings don't imply in any way that CPS involvement, OHP, or aging under care are not disruptive, traumatic, or stressful for the kids and families involved, or that interactions with CPS are not adverse experiences for these families. So I do have some implications for policy, but I think we can talk about that in the Q&A, and I'll move on to the next speaker. Great, thank you.
Hi. I am Hak Sunan and so grateful to be part of this powerful workshop. I've been to many workshops, but I can tell this is the most powerful workshop, and I love this opportunity to learn from my colleagues and learn from you. And I'm so grateful to be here. And today's my presentation, so like Ronnie said, I sent my PowerPoint a few days ago, so didn't have time to update some languages. So, but I'm going to talk about the removals or separations, and also the CPS involvement or investigations in child welfare. And when I prepare for today's workshop, what would be the best fit for the workshop? So I've been doing a lot of research, especially around the evaluation of Maryland child welfare policy and practice. And then I wanted to focus on the impact of family engagement. So what I learned from my research and how I utilize this concept in the research. And when I find out the outcomes of the family engagement, how to inform these findings to inform the child welfare practice and policy. So I have only 10 minutes, so I might go a little bit faster, but my slides is available in the website. And these statistics, we saw a lot of statistics already. I'm not gonna go deep into those numbers, but just wanna show you just brief guideline, the overview of Maryland situation. So compared to national statistics, Maryland 15.7 children per 1,000 children received either investigative or alternative responses. And there are 4.6 victim children per 1,000 children in population in Maryland. And when I look at the maltreatment type, the physical abuse is almost 19%, neglect is 56%. But the area of concern was sexual abuse percentage. And then we have been looking this increased percentage after the COVID pandemic period. And however, when I look at the data, so when you look at the number of cases for sexual abuse, that number has been increased a lot. So it's almost the same, but indicated cases or reported cases has been decreased since COVID-19. So which means, just a simple math, the numerator stays the same, but the denominator decreased. That's why the percentage increased. So I just want to point out that why Maryland sexual abuse percentage is so high. And then this slide shows a general snapshot of the population. So African American children are 31% of the total children population in Maryland. However, in child welfare population, they are 52%. This shows disproportionality in child welfare system in Maryland. So my research, there are several components of the research, and I've been conducting this research since 2009. And then along with the child and family services review, and Maryland completed CFS around 1, 2, 3. And I want to focus on the CFS round 3 in 2018. And the Maryland CFSR process was a state-led CFSR process. So which means we were approved to conduct our CFSR in partnership with the university and the state child welfare agency and the local Department of Social Services. And since 2018, we have not stopped any of this process. We continue to do this research and then just utilize this opportunity to have voices from frontline workers and also work with families and youth and other professionals involved in this case to better understand and to have a comprehensive understanding of the cases and review of the outcomes. So the process is like I said, everybody involved in the case, including families, bio parents, and foster parents, relatives, and educational professionals and medical professionals. We conduct an interview with those people, and then we hear their stories and their experience. And sometimes when you contact those families or workers, they were like, why are you contacting me? And is there anything wrong with my case or with me? And then, no, this case was randomly selected from the administrative data, and we want to inform and collect the information and inform the policy and practice. And then after those interviews, we look at those findings, and then we develop the report of the findings, and we communicate with the local Department of Social Services. What are the area of strengths of your practice? What are the area of needing improvement? And how do we improve the services? How do we improve the process working with the families and children? And then we communicate with the local Department of Social Services on a regular basis to provide the technical assistance. And also, when you look at the data, it is really important to inform the policy. So how your practice actually make a changes in the outcomes. And then these are 3 major pillars when you look at those outcomes: safety and permanence and well-being. And of course, these 7 outcomes, to rate those 7 outcomes, there are hundreds of indicators to look at and measure to get generation and the rate for those 7 outcomes. And we utilize a lot of data, not only quantitative data, but also qualitative data, because quantitative data shows, yeah, here is a number, here is a strength, and here is an area of needing improvement. However, the qualitative data also provide a lot of insightful information and also support families' voice. So we conduct a focus group twice a year statewide, and so far that has been really a wonderful and insightful process. And those are the overall outcomes from those research related to service planning and the family contact and the family engagement and the well-being and also area of needing improvement. And however, throughout all the process, actually the family engagement has been identified as a very critical component to improve children's safety and permanence and well-being. But also at the same time, the family engagement has been identified as an area of needing improvement because of lack of a visit between workers and bio parents. And we are not only looking at the quantity, the frequency of the visit, and also we are looking at the quality of the visit. So during the visit, the families, can they talk about their needs or the services or their struggles, and also what kind of conversation do they have to improve the services or to provide better services to meet those families and children's needs? And also, when I talk about the family's needs, the CFS Round 3 report identified that for children, 71% were rated as a strengths. However, only 40% were rated as a strengths for parents. So when you talk about these parents' needs and services, and the workers in the beginning, workers say that we removed the children from them. Why do we need to work with the mothers? Or why do we need to reach out to find the biological fathers? However, in the process, it's not only working with the children. So working with the whole family and also other children. If there are some children remaining at home, what about other children? And also mothers. And even though the reunification is not a permanent school or guardianship or the independent living was a permanent school, still the workers agency should make a concerted efforts to work with mom and then to build the relationship between mom and children. And also the fathers, sometimes fathers it's hard to identify their whereabouts and exceptional cases, but though except those cases, the workers are supposed to reach out to those fathers and also ask for their needs and then how the agency provide the services for fathers so that they can be involved in children's lives to have a better outcomes for children's well-being. So family engagement. So I learned that family engagement is really important and critical. But how do I operationalize this family engagement? How do I include this family engagement in my research? That has been really like my struggle and question. So looking at a family team decision meeting, so I was looking at the family engagement and a family's experience through this FTDM, family team decision meeting. And then this meeting has been statewide implemented in 2012. And then some like the trained facilitators, they as a neutral person, like a third party who is not working on the case, they facilitate the meeting and then they create a safe space for families and also for youth and workers and supervisors. So whoever involved in the case in child's life, they come to the meeting and then they talk about the case goal and then what would be the best interest for the child. And then I saw that many children were diverted in lieu of removal as an outcome of this meeting. So this meeting happens at the time of removal, planned removal or considered removal. If they didn't have this meeting at the time of removal, the workers should have this meeting within 6 weeks timeline, even after the removal. And then they have to put those data in the administrative data and also the placement changes. Those are very important changes in the case. The workers were supposed to have this meeting to talk about the case goals and also the families can talk about their experience and also provide the feedback. So in terms of the outcome, the impact of family engagement, what would be the outcome? I was focusing on the service outcome and also the permanency outcome and also preventing re-entry. And then what are the impact of family engagement and utilizing a lot of data. Like Ronnie, the Wisconsin has a really great linked administrative data system, but in Maryland, we don't have those linked systems. We have child welfare administrative data. However, this data was not linked to those family welfare, the public assistance. I've been talking about that to state agency for years and years. So instead of waiting for them to do this, I just conducted my own survey to collect the information, the statewide survey to collect the feedback of families who are involved in child welfare system. And what I found, which the paper was published last year, thank you, Darcy, for accepting my paper. And then this study found that at the meeting, and then the workers talk about the services that can be offered to those families. However, we found that white family members were found to be more likely to be offered services, especially financial services, which was an area of concern because among the respondents, we found that the individuals whose income below the poverty line and were in more needs of financial support were African-American families. However, they were not offered those financial services However, they were in great need of services but not offered. And also the poverty line shows that the individuals below the poverty line were less likely to offer the employment services, mental or physical health services, any kind of services. So this one shows that this study shows the child welfare service disparities by race and also by income. And another study just published this year was that I look at the administrative data and looking at the association between the family engagement and the permanency outcome, especially around the reunification outcome in Maryland. This was the first study looking at those examining association. And then when you look at this pie chart, removal FTDM was only 46.05%, which means the children who were removed, only 46% of children had a removal FIM. However, FTDM, I'm sorry, the name has changed from FIM to FTDM. I'm still used to say FIM. So, this is the number that I've been talking with the workers, frontline workers. The number is supposed to be 100%. All cases were removed. They should have removal FTDM. So so consider the removal or planned removal, emergency removal, any types of separation, they have to, the parents and the children and everybody, the other relatives and the grandparents and the other professionals, they come to the meeting and talk about what would be the best service plan and what would be the best goal for this child. However, 46% of children had a removal FTDM and 31% of children didn't have any types of FTDM. And other types include placement changes or permanency changes. And then, of course, workers and the local agency, they are saying that we scheduled the meeting, but the parents didn't show up or the meeting was disrupted because before the end of the meeting, the parents left or we tried to reschedule the meeting. However, it was, we didn't have enough time or I have too many caseload to work on it. So, but I understand, however, the importance of this FTDM, this family engagement and talking about the services. And when I look at and examine the data, so children who had a removal FTDM had a higher probability of achieving reunification by 41%. And also when I look at the children who achieved the reunification, children who had a removal FTDM, they were able to reunify with their parents much faster than other children, like children who did not have removal FTDM. This finding shows that families who participated in the removal FTDM more likely to involved in the case planning and also identification of their needs and the services they need from the beginning of children's out-of-home placement. And then I was so excited to find these numbers, and whenever I had a chance to talk to local Department of Social Services and child welfare workers, here is your practice outcomes. So your practice has impacted in achieving this reunification, and then this is a scientific evidence. And also I brought these outcomes to the state, and also we talked about the changing the policy related to FTDM. Now Maryland changed the policy and updated the policy to expand the FTDM, and also to expand the FTDM, they also changed the definition and the boundaries and who can facilitate those meetings. Okay, so, and the future study is only related to re-entry, and currently I'm conducting this and analyzing the data related to re-entry outcomes, and then I'm looking forward to sharing these outcomes when I have a chance next time. Thank you.
Good afternoon, everyone, and good afternoon to our virtual audience. Normally, when I'm doing this presentation, I'm doing this presentation with a panel of my core team, and we're here for about an hour. Since we don't have an hour, I'm gonna really have to scale this down. But I really want to focus on something that we think is very innovative with regards to a participatory investigation research project that I had the honor to be a part of as someone with lived experience. And we want to talk a little bit about, you know, how do you integrate lived experience, not just as data resources, but also in the co-creation, co-design, co-decision-making of a research project. And so for those of you who are in our virtual audience, you should have in the chat feature, you should have a little one pager. And for those of us who are in the audience here, this will give us you an overview of this participatory research project. So in the interest of time, I will just share basically my experience on the project. And so some of the key questions that we asked is, you know, what is the role of investigations and early case planning? And why we wanted to ask these questions, because we saw that there was limited research around the front end of child welfare. And so we wanted to ask, what was the purpose of an investigation and when is it necessary? How well is it serving that purpose? How equitable is it in serving that purpose? And what should be the appropriate responses to families in need? And what should be the appropriate response to families struggling to meet their needs and keeping their children safe? And so we also wanted to have an opportunity to speak to parents, 100 parents from across the country, from diverse backgrounds, from diverse experiences, because we want to really ask them, you know, what was their experience like when they had to have an open investigation around child protection. And we also asked youth as well. We also wanted to know what kind of supports or resources did they receive, if any, and really wanted to know what the effects of that experience was on them and their families. So the project design was around parent interviews, youth interviews that was conducted by Think of Us, attorney focus groups, surveys to judges, and we also had surveys for child protective CPS workers. And I highlighted parent interviews because that was pretty much the most intensified part of our research, is what we really wanted to hear, because we normally do not hear and we normally do not ask the experiences of birth parents. And so we really wanted to really focus and center their experiences throughout this project. So our participatory approach was a collaborative effort of 5 parent members from the Alliance Birth Parent National Network, such as myself, the Children's Trust Fund Alliance, the Aviv Stand Together, and Annie E. Casey Foundation staff. Those were our funders, Child Focus, and a research consultant. So the participatory process for both parents and youth was designed. We were co-creators, and we also helped with the process and protocols. And I think that was something that was really intriguing for me to be a part of, because again, I wanted to be a part of something that is a little bit different ask. They usually ask us like to kind of read some research or review some articles or give feedback about something that's already been created, already been prescribed. But this was an opportunity for me and other parent leaders to really be a part of that co-creation from the very beginning. And so also what was also great about this project was that we also were able to interview the parents. So those of us who had lived experience, we were going to be the interviewers for the parents with lived experience. So again, this process was that we conducted 100 interviews of parents and 31 young people from across the country. Parents that were selected provided diversity of populations, interviewed in terms of race, gender, urbanicity, and whether the investigation led to an open case or to a removal. And we did the same thing when it came to young people. And I want to just share a little bit about my experience on this project. At first started out as, I think, business as usual, status quo type of, because we don't know what we don't know, right? And I think when you have parent voices in the room, and I think the diversity of us 5 parent partners that were part of this research and part of that core team, is that we were going to speak truth to power. I think that's the reason why we were selected. But we're not a monolith. So we brought our own experience, our expertise, our skills, our critical thinking hats to the conversation. And we really wanted to ask the questions of, why are we doing this anyway? Because I think we know what the outcome is going to be, what the answer is going to be, what the parents are going to tell us. So why would we have them go through something that is so traumatic for the purpose of what? You know, that was kind of what we kind of pushed back on. And so, and we had some really, really live, rich, I would say, debates. They were respectful, but it was really about us really wanting to understand why we were doing this, why, if we were going to be parent partners and parent leaders in this work, we didn't want to be seen or doing anything that would be considered exploitive of other parents. That was very important to us. And there was a level of integrity that we wanted to maintain throughout the entire process. Like I often say, the process is just as important as the outcome. So if we were going to be centering families and their voices, and if we were going to make sure that in everything we do that we valued that, then we wanted to have a process that was reflective of that, and to make sure that it was representative of the dignity and the worth of every parent that we were going to be interviewing. And so some of those conversations we had we bounced back and forth. We had a circular kind of process, and they asked us how we were doing. And we were like, no, y'all not doing too well when it comes to really what is authentic partnership and meaningful engagement. And so part of that is because they had the funders meeting at a different time and a location. And we were like, well, why are y'all having separate meetings with the funders? Why can't we have these meetings together and talk about this process together? And I'm someone who loves to learn. So I want to know everything about research. I want to know everything about what other people's roles are. I want to know about the process. So I want to know. So bring them into the space and let us have these conversations together. And to the credit of our colleagues, they were able to say, yeah, let's do that. And also there was a time where people thought that maybe they would want to prescribe what we should be doing in this process. And I felt that was a little bit minimizing. Oh, well, you know, we don't want to take up too much of your time. We know your time is valuable, but I can tell you what's valuable to me, and I can tell you what I want to be a part of. And so I just spoke up and said, hey, let's, I don't think no one else is being asked that question. So at least ask us before you make a determination in terms of what my time and what I will be able to do. And what I was able to do was be on part of all of it. I was on subcommittees. I was also featured in the video that we sent out to the parents when we were talking to them about the whole entire process. We wanted to let them know the context of of what we were doing, but we also wanted to let them know that they were in the driver's seat so that they could tell us exactly what they wanted to share with us when it came to their investigation experiences and what happened at that front end of child welfare. We wanted to let them know that we parents were a part of this core team. So we helped to develop the protocols and the questions that we would be asking them. And so that was just a really, really rich experience. And we wanted to make sure that we had our hands in all aspects of the work, and that's what we actually did. So in about 15 different ways, we pretty much asked the question about what does it feel like to have to experience investigations due to allegations of abuse and neglect. And I'm not going to share, as you guys look at actually what parents had said, I want to talk to you a little bit about what I heard when I interviewed parents. And we did have, we came back and we had debriefs around what we heard and just understanding if we were doing this process in the way that would be respectful of the voices of their experiences. And I think we talked about this earlier and today, but it was really the abject cruelty that was what we heard time and time again. And I want us to sit with that a little bit and not gloss over it, because it almost kind of took over exactly why families were being investigated. It was people being cruel to one another, being mean-spirited, dehumanizing, devaluing people just because they had because they were in a position of power and authority, weaponizing that power to the person, to the parent, everyone we heard. It was this dehumanizing, devaluing experience. We also heard about the lack of empathy and the lack of transparency, families not even knowing what their rights were, the lack of transparency, sometimes hearing that, you know, their children were removed before they even knew they were being removed. And so, and also ignoring their perspectives, ignoring what was important to them, what was going on in their family, and really looking at what was on a piece of paper and not really seeing the totality, the whole human experience of a family. We heard about lack of power and influence in the process. Again, families not knowing what their rights are, not being told what the process would look like. Okay, this is what's going to happen next, and this is when the next time you're going to see your child. None of that really occurred, and it just felt like, you know, they lost their autonomy. And I think it was by design from what we heard from families. You know, and also that was the fact that, you know, they didn't know that they were even supposed to have any services. No one told them that there's some support for them so that they could keep their children. We heard a lot about that. Some people said they didn't even know that they could ask for help because it was about an investigation, forensic type of process. And so it had nothing to do with, we're here to support you. It was more about, we're here to investigate you. So with the intent of removal. We also heard about the different experiences from parents. Not all parents were the same. You know, we heard from Black parents, the Black parents that I interviewed. When we're talking about the most egregious things that we heard, it usually came from Black parents, brown parents, 22 investigations. That's what we heard. I was on an interview where a parent, a grandmother had been investigated several years, and she had her grandchild, and her grandchild was removed and never seen again. No history, no court, no nothing, just disappeared. And so we also heard a lot about fathers feeling like they're invisible. Fathers not being able to get the support that they needed to be able to parent. It was like, we're just going to talk to the mothers and you don't really exist. And also just about, you know, parents who were struggling with substance use, just how demonizing they felt, how belittled they felt. So we heard a lot about those experiences, and we did have some positive experiences. We did hear a few. But even with that being said, we heard that even if they had some positive outcomes, it might have been a worker who was positive, the experience of investigations itself was harmful, and this could have happened in a whole different way. And so I know that we're running out of time. And so I just want to let you know that if you do want to hear more about this investigatory process and the way in which we approached it, you can always contact the Children's Trust Fund Alliance, and we left that information for you. But I want to say that my experience really is around making sure that when we are at the table as co-creators and co-designers and making decisions, we can really change the way in which we research. So as you see me here, think about the possibilities of integrating lived experience in your work, not just for data purposes, but also how can they be a part of making a process even more richer and more fuller? Because I think that's really what happened here. We were able to build a really great team that really got some excellent data from families. And what we ended up doing is families were saying, thank you. We're able to, this is the first time I've ever been heard. This is the first time that I felt supported because you had lived experience. I felt psychologically safe to share my story. And so thank you. And what part of our thank you was making sure we checked in a couple of days later and asked them, is there okay if we wanted, just, are you okay? Was there anything else that you wanted to share? How did you feel about this process? Was it respectful? Because that was very important for us. And after every single time that I actually did an interview, I kind of held that space. I wanted to hold on to what they were sharing with me. I was honored and humbled to be a part of that. And so I would write a thank you note. I would sit there and write a thank you note and mail it to them. And just to let them know that their voices, their stories were impactful and we were going to do something about it. And what I got back from folks was a text message saying, thank you. It's the little things. And so if you want to hear more about what we're doing, and we'll talk about the findings and all of this whole hour presentation, we do have a Birth Parent National Network virtual convening that's coming up on June 8th. And so you can go to the Children's Trust Fund Alliance website, and there's a registration on there. And with that said, thank you very much.
Thank you so much to each of you. We have about 9 minutes for questions. And so I think instead of asking the ones that I had prepared for discussion, I would just like to open it up.
I have a question for Lenny and for Darcy, because I'm still thinking on the results that were presented about Wisconsin and about what Darcy said on parents feeling that their child has to go to the foster care system to receive services, to receive support. And that because this is so focused on math and reading, those are the things that you can improve with special education services, having an IEP, now that you're in foster care, etc. So I want to ask to both of you, how are you making the connection between the pieces that each of you were presenting?
So it is disturbing that parents think that the only pathway to getting services they need for tangible things, resources, is through the system. A lot of my parents are struggling with housing insecurity as well. And so they oftentimes get put into shelters through the CPS system as well. And then the shelters then make case reports and phone in when they go downstairs to get food for their kids and leave their kids in the shelter room. So it's a problem we need to identify, and it starts with the mandated reporting as well, because teachers and these reporters, there's a pretty big stick. There's a major consequences if they don't exercise an abundance of caution and make those calls. So if teachers in a school and child seems to have not been, eating a lot lately or sleeping at the desk or something, they make the call out of an abundance of caution. But if we could address those issues that parents and families are having without making the call to the punitive system that puts a lot of pressure on people to address, then we can maybe be more helpful than harmful, because it is a huge problem. And I've heard a number of times parents feel like, well, I have to get involved with the system because that's the only way I'm going to get some food stamps, or, I need to do crib, or I need to do bed, or I need somebody to talk to the landlord and deal with the lead. And the wash machine's broken, but I'm behind on rent, so I can't talk to my landlord because then I'll be in trouble again. It's a vicious cycle. And so it's a lack of supports. There need to be community supports. And it's my personal opinion that the CPS system is not suited to address these types of neglect, this type of neglect. And I think it's too far gone. The title, the name, the language, the stigma is too far entrenched to be used to address issues of neglect. I don't know what it looks like. I just know it's not the CPS system for these cases.
So my full answer would take about a week, but I'm going to give you a abbreviated version. So I tend to think of the vast majority of CPS cases as reflecting two things: constrained opportunities for impacted families and missed opportunities for the public. And by that, I mean missed opportunities to provide economic support, to provide mental health services, substance abuse services, home visiting services, a range of things. One thing that didn't come up in this conversation, 81% of all reports receive no services, none. Those families that are either screened out or investigated with no finding come back at very high rates. 81% of those 4 million reports in a year. That is a group of families that we know could benefit from services that we have identified, and we generally do almost nothing until their situations get worse. And I think that, and had I gotten to my policy implications, it's the wrong time to start once they're in CPS. We need to be thinking about it earlier. And there's some, growing literature on economic supports, child tax credits, things like that.
And also in terms of services, so the federal's definition is if agency made concerted efforts to provide the services. But what is the definition of concerted efforts? Oftentimes when I talk to workers, they were like, we made a referral for these families for the services. However, the families, mothers or fathers, because they lack of transportation or the child care issues or their work schedule issues, they were not able to make those visits to receive those services. In the case, if agency made a concerted efforts, that's the agency's, the child welfare workers' definition of concerted efforts. However, in terms of the family's perspective, they have not received the services they need because of all other things. So when you look at the services, it's not only one component, but the whole situation of the family, and then what is the comprehensive services that we should consider. Yeah, that is the question that I have oftentimes when I communicate with the local child welfare agencies and also families.
I just want to read a comment from the Zoom question box. It's from Ayana Jones, and she says, information shared here is rich and very informative. I was wondering what are other steps to get this information to frontline workers and child welfare policymakers. And funding and time a real barrier to getting some of these persons in rooms such as these with such important exchanges. Are there ways being thought of to fund, encourage these untapped and important potential partners in rooms such as these? Which I will share that with as many people as I can.
Kelly Gurka from the University of Florida. I have a follow-up to Celia's question. So if children only receive certain services, if they are placed in foster care, how do you disentangle the impact of receiving those services from the effect of the care received from a birth parent versus a foster care provider?
So that's the point. So exactly what we're seeing is kids get services when they go into foster care, they don't at home. When kids, so the aging out, when kids age out of care, there are a host of services available to them. When they reunify at 17, there aren't. And so these are the mechanisms, is that there's more care, there's more support, there's more monitoring by the parents generally. But these are the mechanisms. And so I think that that is essentially the argument is if we would have had strong supports for families, we would need less foster care or we would use less foster care.
I think
And I
the
see-
challenge, however, is that when you put data forward that show that children in foster care do better versus children who are not in foster care, if you can't disentangle those effects, then there's the opportunity to say it's.
Those are the mechanisms. You don't want to disentangle those effects. That's exactly what you're trying to identify.
With Lonnie, with that research, the children who aged out, I'm just wondering, how do you get access to those children who are in juvenile justice? And it's a straight pipeline from aging out to being in prison, right? Were they
We have that,
included in
yeah,
the view?
we have the data.
Yeah, and then I also wonder too, which is more, it's a practice question, but it's also to think about something in research. And I just came from a meeting at the Hill. And someone did a talk, which was very interesting, because I always felt this way too, is why are children homeless after they leave foster care, right? So I don't understand how we take children from their families and say we're going to do such a good job. And then when they age out, some of them are homeless, some are in the prison population. And I know you can't catch all those folks. I know you're not catching everybody in prison. I know you're not catching everybody that's homeless. I doubt highly that data is even catching everybody that's going back to their families who still had no services.
So we didn't look at homelessness. We do actually have homelessness information services data that won't catch all the homeless. That will catch the people who are involved with shelters and things like that. So it's a very limited sample. We have the data on every single person who's in Wisconsin prison. So we don't miss anybody who's in prison. This isn't a survey. This is the records from Department of Corrections. This is the records from the public schools. This is the records from child welfare. This is the earnings records. This is the entire population.
So I'm gonna end us because I'm determined that you all get out of here by 12:30, like we said. So first of all, thank you for this panel. I feel like we didn't give you all enough time. I really apologize for that, but I just know that people have planes to catch, so I'm just apologizing to you right out. But I want to thank you. This was really informative, and I'm going to just close us out in 2 minutes. Oh, I have 3 minutes, 3 minutes. So first, I want to thank Michelle again for her intellectual leadership and for getting us together. I want to thank every speaker, not just you all, but all of you that were here over the last day and a half. It ended up being so much richer than I even expected. I mean, I learned a lot, but I also felt a lot, and I just wanted to thank you. I want to thank our audience for being on the journey with us, from, Brian's keynote and those beautiful parent voices to really thinking about our child welfare system for all its weaknesses and strengths, but really understanding it more, to really thinking about the connection of child welfare with criminal justice and substance use services, to then really trying to think about the science, not only in terms of the brain and the outcomes. I'm looking at you too. Thank you for still being here, but also from Cecilia's talk about NSCAW, which, if you all don't know that study, you need to know that study. It is like the best study we have in child welfare thus far. So please pay attention to that, and all the other things that came up in terms of Tyrese's, helping us understand a different kind of caregiving setting. And then, of course, the racial disparities panel that really, I think, really pulled at us, not only to think, but to feel and to learn about the voices of parents. And then, of course, this final panel that said to us, there's tons of ways we can approach research in this space. So hopefully, our goals were met. We had 2 goals: 1, to inform about the child welfare system writ large, and 2, to really get our knowledge broader about the research in this space. So I think we accomplished those 2 goals. I hope you all will take this back and use it to inform your own research, and certainly we will be trying to use it in HBCD. So with that, 12:30.
And can we thank Brenda and Julie for such a wonderful job organizing?